I'm thrilled to have all of you here. It's wonderful to have a packed room. What I am going to do is just walk you very quickly through our agenda and then introduce our Chancellor at Rutgers Biomedical Health Sciences, and he will begin with some opening remarks. So I am the Outreach Director for the Center, as well as an Associate Professor in the School of Public Health. It's an enormous privilege for me to be part of this exciting new endeavor for Rutgers and the state of New Jersey. We're going to begin in part because we have so many people to thank who have been providing support, I envision, to create this new center with a number of welcoming remarks from our leadership here at the school and in the state of New Jersey. After our welcoming address by the governor and Congressman Pallone and Majority Leader Greenwald, I will introduce to you the co-directors of our center, Bernadette Hull and Michael Osterman. And they're going to walk you through the organization of the center, talk about its mission and its vision, and how we plan to do all the work that we're going to be doing over the coming years at the center. Once they give you that kind of broad overview, I'm very pleased that we will have an exciting keynote address by Dr. Stephanie Bonney, who is our Director of Surveillance at the center and a trauma surgeon in Newark. And she's going to talk about the state of gun violence in New Jersey and explain why gun violence is a public health issue. And then finally, we are going to have a panel. One of the things that we're quite excited about in the center is it helps to bring together various parts of the Rutgers campus. We're spread out all over the state. We have a lot of capacity and a lot of expertise, and this is an opportunity for all of us to work together on this important issue. And so we have a panel of researchers from across the university that will be moderated by our Director of Research, Dr. Paul Boxer. After that, we'll open it up for Q&A, and we'll be thrilled to speak with you at the end of the program. Again, I'm the Director of Outreach, and so I want to reach out to all of you and get involved with many of the groups that are here. Thank you so much for being here. So, without further ado, please let me introduce the Chancellor of Rutgers Biomedical Health Science. Dr. Brian Strom is not only one of the leading researchers in the world with expertise in pharmacoepidemiology, he was the inaugural Chancellor of Rutgers Biomedical Health Science. Under his leadership and his vision, we have grown enormously. Our capacity in research, teaching, and clinical service just continues to astonish me. So it is a great honor for me to introduce Dr. Strom, who will give you some opening remarks. Dr. Strom.
So thank you, Michael, and I pay him to say that. Good morning. It's my pleasure to extend greetings and to welcome you on behalf of the faculty, staff, and students of Rutgers Biomedical and Health Sciences. In addition, I'd like to extend greetings from Chancellor Cantor, Nancy Cantor, and the faculty, staff, and students at Rutgers University, Newark. The New Jersey Center for Gun Violence Research at Rutgers is a joint program between RBHS and Rutgers University, Newark's School of Criminal Justice. Chancellor Cantor is a leading voice in the growing national movement to connect institutions of higher education and other anchors with their host communities in meaningful ways. Clearly, this issue has a disproportionate impact on our urban areas, and our collaboration between our chancellorships is yet another example of how higher education institutions can contribute to solving problems that matter to our communities. Thank you, Nancy. Today we address one of the most acute public health problems of our era, gun violence. Across our nation, there are over 100,000 firearm-related incidents annually, with almost a third of those resulting in a death. In our own state of New Jersey, we suffer close to 500 firearm deaths per year, a majority of them from homicides. There are known but underutilized ways to address this, and other new approaches are needed as well. That's why we're here today, to share ideas, generate dialogue, provoke debate, and lay the groundwork for evidence-based policies and generate scholarly collaboration in an interdisciplinary fashion. We're here today because at a national level, our leaders have allowed politics to interfere with the free and open inquiry of science. And in response to this artificial and deadly moratorium, our state leaders have generously and courageously provided us with the means to bring the tools of social science, law, public health, clinical care, translational and laboratory research, and the humanities to bear on solving this problem. We're also here thanks to the broader vision of our state's leaders and the commitment of our board, faculty, and staff when they decided 6.5 years ago to merge most of the old University of Medicine and Dentistry of New Jersey into Rutgers to build a truly comprehensive university. Combining our platform of wide-ranging education programs, research infrastructure, the national name recognition and reputation of Rutgers University, along with the statewide academic health system we're building in partnership with RWJ Barnabas, Rutgers is optimally positioned to be the model comprehensive research university for the 21st century. Today, we can treat the clinical needs of patients with gunshot wounds in our trauma wards, ease the psychological burden of losing loved ones, quantify and start to alleviate the chronic insults to well-being that are associated with socioeconomic inequities in our society, and derive new solutions to this massive public health problem. And for the next 2 days, we will deploy our collective resources to determine how best to deliver compassionate care, to discover and deploy new techniques, treatments, and interventions, and how to support the economic activity in our host communities so that one day we can say that the plague of gun violence in society is over. Lastly, and relatedly, we're here today in part because of the vision of our next speaker. Under his leadership, Rutgers University has, now more than ever, the global reach and scholarly breadth and depth to address such complex and deeply rooted societal problems as gun violence. Under his leadership, we're actively engaged in solving the real-world problems of the society that we live in, meaningfully engaged with our host communities, and impacting the social determinants of health. So it's my pleasure to introduce the president of Rutgers University, Bob Barchi. Bob?
Well, good morning. It's great to see such a crowd here today, and it looks like a packed house. I'm going to be very brief because we have a panel of important speakers that will eclipse what I have to say, and Brian has already made mention of many of the key points. But we're starting yet another big initiative here in public health. Now, that should not be a surprise to anybody. After all, it was a Rutgers alum who first identified the disease that we later came to call AIDS. And it was at Rutgers where the antibiotic streptomycin, critical tool in public health medicine, was discovered. And it was just a few years ago when the Obama administration turned to Rutgers to ask, what are we going to do about the issue of sexual violence on campus? And our faculty are tracking some of the biggest issues of population and public health, whether it's obesity or opioids or autism or cancer, or in this case and in others, what are we going to do about this issue of gun violence and its effect on our nation? And this is another major public health issue. There's just no question about it. It's one that we stand ready to help with. And I should point out that we are one of only 2 centers in the entire nation that have been set up to deal with this issue. And I have to say that's not entirely because others aren't interested in dealing with it. It has to do with the approach that this nation has taken to dealing with the topic in general. Let me just put this in perspective with the news that we've had recently. We just celebrated 50 years since the Columbine mass shooting. Now, Brian has talked about the use of guns in homicides across the country. Let's just focus for a second on the mass shootings that have occurred in the last 50 years. In those 50 years, we've had 50 additional mass shootings, 10 of them occurring in high schools and colleges. 548 people killed in those episodes, and that's just since Columbine. Over 1,000 since the end of the 60s. Now let's take another look over to New Zealand and the massacre in Christchurch. 26 days for the nation to pass a law banning all semi-automatic weapons. 26 days. 50 years, and we have yet to do anything at the federal level. I'm delighted that our governor has taken initiatives here at the state, but at the federal level, we are still not making any movement. That's why we have a crisis here, and I hope that's something that this new center will help to address. So we have a governor who I know is all in on combating gun violence. He's had a number of initiatives, including the ghost gun legislation recently passed, and I know what his views are on this. I know that he's interested in supporting action here in New Jersey. And Rutgers is delighted to respond to that call to help with that, to provide the basic research and the applied research and the solutions-based outcomes work that could help with these efforts. It's a crucial issue that we have to address in a holistic fashion here in New Jersey. And once again, we have to lead the way for the rest of the country, just as we did in the sexual violence on campus enterprise, to show exactly how this can be dealt with and how others might be able to address it. So I'm delighted that Rutgers is part of this. I'm delighted that we can gather today to kick this off, and I'm really eager to see what's going to come out of this. So now it is my job and my deep pleasure to introduce our next speaker, who is the 56th governor of the state of New Jersey, a good friend of higher education, and a strong supporter of Rutgers, Governor Phil Murphy. Governor Murphy.
Thank you very much, Bob. Good morning. Good morning. Wow, I just said to Bob that I say this as the former U.S. ambassador to Germany, that he's more on time than a German train. I want the record to show it's 10 o'clock on the nose. Good morning, everybody. It is so great to be here and be back, as I've come so many times at Rutgers, particularly on this beautiful spring day. And by the way, if you're wearing a t-shirt, particularly in red, I see you all out there, and thank you for everything you do. And purple, sorry, right down here. I don't want to leave the Brady crowd out of us. So to University President Dr. Barbarchi, thank you very much for your support, your friendship, and your introduction, which I hear was marvelous, by the way, as well as to the co-directors of the New Jersey Center on Gun Violence Research, Dr. Bernadette Hole and Dr. Michael Osterman, to the other leaders in this multidisciplinary effort, Drs. Paul Boxer, Stephanie Bonney, Michael Gusmano, and Elizabeth Sloan Power, and to the whole team. Thank you all for everything you do in leadership. I don't think they're here. Actually, I see him. My Congressman, Frank Pallone's in the house. Bless you. State Police Superintendent Colonel Pat Callahan is with us. Pat, honored. I don't see Majority Leader Lou Greenwald. Is he here? I know he's coming to speak, and I want to give him a shout out along with Frank and the Colonel and others who are huge advocates for gun safety. And to everyone here engaged in taking on this critical and timely research, let me begin with simply two words: thank you. It is truly an honor to be here this morning. Because of the work and commitment of everyone here, Rutgers University and the New Jersey Center on Gun Violence Research are undertaking a nation-leading research effort. Let me be absolutely clear about the starting point of this effort. The fight against gun violence isn't about politics, and in many ways, it's not even about guns. It's about the search for common sense and far-reaching public policy solutions. It is about treating the impact of gun violence not as a political matter, but as one of the key public health issues of our time. And I say key, and I mean that. It is about how we support victims of gun violence through the process of physical and mental recovery. It's about how we help communities in the aftermath of a tragic shooting or living with the regular sound of gunfire in their streets. It's about how we work together with community groups and law enforcement to create trust and the relationships that can focus on preventing problems before they occur rather than after. It is about finding solutions in unexpected, unconventional, and non-traditional places, like the recently published research that suggested that increasing open green space in a community can lead to a decrease in crime and gun violence. It's about how we can build strong and vibrant communities where no one feels the need to pick up a weapon in response to a challenge. This past Saturday, our nation commemorated 20 years since the mass shooting at Columbine High School awakened both our sense of outrage and our belief that scenes such as that should never have to be replayed. Yet they have, over and over again. Virginia Tech, Aurora, Sandy Hook, Umpqua Community College, Orlando, Las Vegas, Sutherland Springs, Parkland, Santa Fe, Pittsburgh, Thousand Oaks, on and on and on. And even here in our state last summer, early in the morning of Father's Day, when a night of art and community in Trenton was turned into a sea of chaos and indiscriminate gun violence. Over and over, we've heard a long succession of political leaders now utter the hollow term thoughts and prayers. Thoughts and prayers are not sufficient. Action must be our only guiding principle. When I joined our fellow governors to create states for gun safety in the days after the unspeakable tragedy at Parkland's Marjorie Stoneman Douglas High School, we did so with the fear that even under intense public pressure, it would still be left to the states to do the things that Congress couldn't, or worse yet, wouldn't. And I don't say Congress on our side of the aisle, I'll be partisan for a moment, but on the other side of the aisle. And I must single out my chief counsel, Matt Platkin, who was the first person to recommend to me that we form states for gun safety and invest in gun violence research. So thank you, Matt. I also want to give a shout out. He's not here today. He's with his family away for a few days. I want to give a shout out to our senior advisor on gun safety, Bill Kastner, who has been a huge force here. So it is now 14 months later, and the debate in Washington is still as much at a standstill as it was before Parkland, even as our nation has been rocked by more mass shootings, such as the tragic assaults on a newsroom in Annapolis and an iconic synagogue in Pittsburgh, among others. We in New Jersey have acted on the core public policy issues by pushing aside the rhetoric and acting through common sense. We strengthened significantly our background check law. We banned armor-piercing ammunition and limited magazine capacity to no more than 15 rounds. We rolled back dangerous regulations imposed by the former administration on concealed carry that ran counter to the intent of our law. Working closely with Everytown for Gun Safety, Moms Demand Action, Gabby Giffords and Mark Kelly and their teams, and others here today, we instituted a red flag law to ensure that individuals deemed a threat to themselves or to others do not have access to a gun. And in our budget, we will continue to push to modernize state gun fees that have not been touched since they were first enacted more than 50 years ago, 1966 to be exact. Governor Dick Hughes was in office. Right now in New Jersey, it is cheaper in most communities to get a permit to purchase a handgun, $2, than it is to get a dog license. That is backwards, and it must change, and it will change. In addition, Attorney General Grabir Grewal and the New Jersey State Police, under the leadership of Colonel Pat Callahan, have cracked down on internet ghost gun sales and have undertaken a first-in-the-nation reporting system, NJ Gun Stat, to release data on gun violence in New Jersey. This has allowed us for the first time make it clear where the guns used in the commission of a crime come from. And we shouldn't be surprised that in 2018, more than 80%, I repeat, more than 80% of those guns came from out of state, and the majority flowed into New Jersey through the so-called iron pipeline along the Route 95 corridor that cuts through states with weaker and in some cases nearly non-existent gun safety laws. Last month, the Attorney General and the Colonel and I announced that NJ Gunstat would begin naming and shaming not just the states whose lax laws contribute to our gun crime crisis, but also the manufacturers of the most popularly trafficked weapons. Our residents deserve and need to know the preferred firearms of traffickers and demand that officials hold manufacturers legally and economically responsible for their products. Those were all great accomplishments, and they returned New Jersey to our rightful place as a leader in implementing thoughtful and effective gun safety laws, but we're not spiking any footballs yet, believe me. Today, we are engaged in an effort to build upon these successes. It's something that we like to call Gun Safety Package 2.0. This second effort would close existing loopholes to make it easier for prosecutors and police to go after gun traffickers and keep illegal guns off our streets, regulate and track ammunition sales, and assist community-based organizations in implementing coordinated, evidence-based violence intervention strategies, which is one of the key areas of focus of our friends Gabby Giffords and Mark Kelly, who were here for the designation, I might add, of this center. We have used the best available research to guide our efforts to date, but as we all know, that research has had its limitations. Today, the so-called Dickey Amendment, by the way, what an awful piece of legislation, right? Can we all agree on that? It may be gutted as a matter of fact, but the continued limitations on the use of federal funds to take the deep dive into the issue of gun violence, and the whole left, I might add, from 20 years of key data never even being collected, means that as a matter of deed, its legacy is still very much with us. To more effectively combat the scourge of gun violence, we must undertake the important multidisciplinary research that Congress had blocked for more than 2 decades. We know that an academic consortium bringing together insights and opinions from across our region is the way to go, and it's the way to go about conducting this vital work. I stand here today proud that the New Jersey Center on Gun Violence Research is the first such center on the East Coast and just the second in the nation. Moreover, I am incredibly proud that this work is being led by Rutgers University. Oh my Lord, I just noticed that our Secretary of Higher Education, the singular Dr. Zakiya Smith-Ellis, is with us. Pardon me, Madam Secretary. What an please stand if you'd like to be recognized as well, what an enormous embarrassment, Zakiya, that would have been. Diana, keep me honest down there, Deb. Over the coming months, and especially as we move to the summer, when we typically see an increase in gun violence, we want to deepen this partnership, not just among our administration, but with the advocacy and community organizations across our state working on a daily basis to combat gun violence. And to all the advocates here and around the state, I don't know where we would be literally without you. Thank you for everything you do. We all must come together to listen and learn and to build meaningful connections between data-driven research and on-the-ground experiences. With firm footholds in each region of our state, Newark, New Brunswick, and Camden, North, Central, and South, we can ensure not just a whole of Rutgers or a whole of government, but a truly whole of state approach that will educate and inform the solutions that we will need to make sound public policy decisions. That is why I am also pleased to announce today that I am convening a meeting, bless you, with Rutgers. We don't miss a thing up here, except occasionally members of our cabinet. I'm also pleased to announce that I'm convening a meeting with Rutgers and the mayors of our cities that suffer from the highest levels of gun violence prior to Memorial Day, with the goal of facilitating a partnership with the Brady Center on the issue of crime guns. Just as states are filling the void left by Washington on gun violence, we can also partner with our cities to use data and information in our efforts to reduce gun violence. So I thank the Brady team, led by your chair, Kevin Quinn, I think a 30-plus-year-old friend of mine. So great to have you with us in the fight. Knowledge, as they say, is power. The lack of facts, either because of the Dickey Amendment or past disinterest by past administrations, has allowed the gun lobby to live up to the words of Mark Twain. And I quote Mark, get your facts first, then you can distort them as much as you please. Well, I ascribe to a different viewpoint, that of the late Daniel Patrick Moynihan. Everyone is entitled to his own opinion, but not to his own facts. Amen. Senator Moynihan was a big hero of mine, and I think of many here. I have to tell you a quick story. I don't think the folks who wrote it are with us this morning, but I got my briefing memo for my remarks today, and I've been working on my remarks as I normally do over the past day or two, getting ready. And in the memo, there are photographs and biographies of anybody who I am mentioning in my remarks. And there was a photo of the late Senator Daniel Patrick Moynihan with a nice, robust bio. And beside his name, it said Senator Daniel Patrick Moynihan, not attending. So given that he passed 18 years ago, I believe, and we miss him to this day, I was rather gratified to hear that we were not in the same place this morning. Grover Cleveland also could not make the, something must have come up for him as well. So back to the facts. And this must be the goal of the New Jersey Center on Gun Violence Research, to replace opinion with irrefutable and undistortable facts. We are already proving through our actions that we can have common sense gun safety laws that are fully respectful of the Second Amendment. But we must look at the issue of gun safety through the prism of the devastation that gun violence has brought on communities across our state. We must undertake an effort to lift up the preamble of our own Constitution and its call for us to form a more perfect union. So let us take our inspiration from the words of Dr. Bonney, and I paraphrase, we are not anti-gun, we are anti-bullet hole. If there is to be, if there is to be a mantra for the work of the center, or for those of us in positions of leadership, this sums it up nicely. Again, I'm incredibly honored to join you this morning. I wish I could stay, I cannot. And I'm so proud of the essential work that you're doing, to each and every one of you at this center, the advocates, the elected officials, the leadership at Rutgers, beyond the entire community. I wish you all the very best for today's symposium. I look forward to our continued partnership for our state and our people, and I thank you. Have a good one.
So thank you. I'm Matt Placken. I'm the governor's chief counsel. Bill Kastner, who's the governor's senior advisor on gun safety, who conveniently couldn't be here today, asked me if I could pinch hit for him. He didn't tell me I was going to be going in between the governor and Congressman Frank Pallone. I have to thank him for that. I'll be very brief. To President Barchi, the leadership of Rutgers, and the leadership of this incredible center, I want to thank you for all the work you're doing. Just as a personal matter, this was sort of an idea we kicked around when the governor was running for office, as Diana, the Deputy Secretary of Higher Education, knows, and to see this kind of room come together with so many people who I know and admire. It's really incredible. And I'm going to I have the honor of introducing one of my heroes, Congressman Frank Pallone, on this issue and so many others. But first, I just need to say something about my boss who just stepped out. He graciously credited me, but I have to say, I don't think there is any leader in the country who is doing more to address the scourge of gun violence than Governor Phil Murphy is. I was prepared to, but I won't go back through every list of accomplishment that he's already done in just 15 months in office. But I thought I might spend 1 minute just to give you some color on how this center actually came to be. It was February 14th, 2018. It was Valentine's Day. We were less than a month on the job. He got sworn in on January 16th. And it was also the day that a breaking news alert that said there had been a deadly shooting at Marjorie Stoneman Douglas High School in Parkland, Florida. We soon found out that 17 children and staff members had their lives brutally cut short that day. Their hopes, their dreams, everything that they had hoped for over the course of their lives were ended by the pull of a trigger. 17 more names that were tragically added to the long list of victims of the national plague of gun violence in this country. And on that day, I was still trying to figure out where the bathroom was, I think. The governor walked into my office and said, we have to act. We can't sit by and do nothing. That RGGI idea, RGGI, that RGGI idea we had on the campaign, I wanted started today. And what he was referencing was an idea that we had put out when he was running for office to create a regional consortium of states that would address the challenges of gun safety, in part because the federal government consistently, unfortunately, failed to act. So he said that to me, and he said, we have to act, and then he walked out of my office and left me to figure it out. And so we started making calls. The governor was personally engaged making calls. I made calls. We signed up several states over the next few days. We drafted a memorandum of understanding, and 8 days after Parkland, we announced States for Gun Safety, the first, to our knowledge, regional collection of states to combat gun violence. By the end of the month, we had 2 more states, and we had assembled a truly bipartisan and regional coalition to essentially do 3 things: to share and collaborate on law enforcement, to share intelligence, and the colonel, who I believe just stepped out, has been instrumental in that, and then the effort led by the Secretary of Higher Education and her team to coordinate higher education research. But we didn't want to stop there. We didn't just want to coordinate research, we wanted to support it. So less than a month after Parkland, the governor announced his first budget on March 13th, 2018, that for the first time included state funding specifically to support gun violence research. After a competitive process led by the great team up here, we were honored to designate the state's leading higher education institution, Rutgers, as the home for this great center. And today's events and the people assembled in this room are a testament to the incredible work that's being done. So why am I telling you this, and what does this have anything to do with Congressman Frank Pallone? It's because, as the governor said, fighting gun violence and addressing the plague of gun violence requires action. It requires all of us, from the governor on down, to stand up and say enough. And when we do, and I know because I've personally been through them, the fights can be hard, and there are a lot of people on the other side. But when we do stand up, we can and will have real progress. But sadly, despite these best efforts, eliminating gun violence is not something we can address or solve on our own. It is a national problem, and it requires national solutions. Unfortunately, Washington has failed to act. But despite that failure, there have been heroes at the federal level as well, and one of them is here today with us in Congressman Frank Pallone. I say this sincerely. We are truly lucky as a state to be represented by someone with the commitment, the ethics, and on this issue, most importantly, the courage of Congressman Pallone. He sponsored legislation banning large capacity ammunition. He's fought to close the gun show loophole. He's fought to expand background checks. And importantly, he voted against bills to protect the gun industry from being held accountable for the industry and deaths caused by their products. Time and again, Congressman Pallone has been one of the leaders in this country who has been unafraid to stand up and say, enough. He has fought to keep New Jerseyans and all Americans safe from gun violence. And importantly for today, he has made clear that he believes gun violence is a public health crisis, and like all public health crises, demands the attention of our best minds and research resources. That's, after all, I believe, why we're all here today. So with that, I'm honored to welcome to the stage one of the finest representatives in this country and in this state, Congressman Frank Pallone.
Thank you, Matt, and let me thank Matt. I'm actually glad that Matt came up between myself and the governor, because if you listen to what President Barchi said and the governor said, it was all about how the state of New Jersey is doing such a great job and the Congress is so rotten. So, as the representative of Congress, it's great. It's not the greatest thing to be up here. But thank you, Matt, really, Matt, for all that you do. And the governor, look, let me just say this. You know, Matt was talking about the campaign and the first days when Phil Murphy became governor. And the one thing about Phil Murphy on this and really every issue is that what he promised during the campaign, he followed through on when he became governor. And the issue of gun safety and gun violence is clearly an example of that. His support of this initiation of this center and all the legislation that he spearheaded and the way that he made our state aware of what needs to be done is really so special. And Matt and him together have worked so hard on this. And you know, I never underestimate the courage that it takes to do what Governor Murphy and Matt have done, because I was actually in the state legislature, I don't know, 35, 40 years ago, when we had another governor by the name of Jim Florio, who banned assault weapons. And I always felt, and many people back me up, that even though when he ran for re-election, the issue seemed to be the tax revolt that made it so he wasn't re-elected, I always felt that it was his support for the assault weapons ban that defeated him more than anything else. And so, you know, it takes a lot of courage. I know that attitudes have changed, and this is not 30 years ago, but it takes a lot of courage as a politician to stand up the way he has on behalf of all these gun safety initiatives. So I want to say that, Matt. And I want to go back to President Barchi. I have to tell you, I loved your remarks off the cuff. Those were the best when we were waiting for the governor. And I remember distinctly you're talking about the grassroots and how we have, you know, Moms Demand Action, Students Demand Action, Brady, and so many different groups here today, and how that reaching out, you know, goes beyond Rutgers. I mean, I'm always proud of Rutgers, as you are, and we always talk about Rutgers and what it does and how important it is. But when I first came into this room today, I saw that this was a gathering that was of people from all ilks. And it is, as President Barchi said, it's that grassroots that's really going to make a difference and has made a difference. And, you know, President Barchi said, look, we haven't done anything in Congress, certainly, in terms of action. We did pass, obviously, initiatives in the House of Representatives, but we know it's going to be difficult because we still have a Republican Senate and we still have President Trump. But it is true, though, going back to the President's remarks, President Barchi's remarks, that we've made a lot of progress in terms of public attitudes and the way the public thinks. And I just want to use two examples, and that's why this center is so important. I remember, because I know many of your doctors, medical doctors that are here today. I remember maybe 20 years ago when I was always supported when I ran for re-election by the New Jersey Medical Society and the AMA. But I remember distinctly going before a panel in the Monmouth County Medical Society before they were going to endorse me, or hopefully endorse me. And I did everything right, you know, everything I was doing in Congress the doctors liked. And then they decided that they were not going to endorse me. And I went to the State Medical Society and I said, what is going on? Why is the Monmouth Medical Society not going to endorse me? And I found out it was because they were not supportive of the gun safety initiatives that I had supported, because many of them were members of the NRA and liked to hunt and would not support someone, even though I was right on all their issues, because of my position on gun safety. And today, it's just the opposite. We went to the, this Our Lane movement had an event with Robin Kelly, as one of the members, one of the congresswomen who's a member of my committee, I guess about 6 months ago. And I was so proud to see the doctors standing up and the AMA taking such a strong position against gun violence and in favor of the gun safety measures. And I don't think most people realize what a change that was, that many times doctors were the very ones who opposed these gun safety measures. People have forgotten that. The other thing that you mentioned, and the governor mentioned, Dr. Barchi, was about Columbine. It's the anniversary, I guess, was within the last week. And I remember talking to Diana DeGette, who's another congresswoman on my committee, who represented Columbine. She's from the Denver area. And she, after the Columbine incident took place, about a week passed, and she came back to Congress at one of our Democratic caucuses, and she got up and told us that the majority response in Denver, or at least in the Columbine in this high school, amongst the teachers and the parents, was that the answer was that we needed to arm everyone. We needed to arm the parents. We needed to arm the teachers. And that was the response. Now, think about Parkland, which was also mentioned by the governor and President Barchi, and the response to Parkland, where the students went out and started this whole movement and demanded that we take action on gun safety measures. And 15, 20 years later, whatever the time period is, major change in terms of attitudes and what people see when they see a mass murder or they see an incident like what happened in Columbine or Parkland. So we have come a long way. There's no question about it. But as was mentioned, we haven't come a long way with regard to the Congress. And you could do polling and surveys, and it'll tell you over and over again that people overwhelmingly would like to see the gun safety measures, universal background checks, limits on magazines, assault weapons ban. But what we need is, we need the people to vote that way, right? In other words, there are a lot of issues like climate change, for example, where everyone's supportive of it, but it doesn't mean that that's a litmus test in deciding who they vote for in November. So we still have a long way to go because, I sound so partisan, but the president and the Republican leadership in the Senate, they're still very much with the NRA. And that's why, this grassroots movement and this gun research is so important. Now, let me just say a little bit about gun research, and then I'll sit down and why the center is so important. My committee is the Energy and Commerce Committee. We have jurisdiction over healthcare. We have jurisdiction over the gun research. We have not, for the 8 years or so that the Republicans were in the majority in the House, we were not allowed to have any hearings on anything with regard to gun research. And I would go oftentimes over to Robert Wood Johnson, the hospital, with part of Rutgers, and talk to those in the trauma center, and they would beg me to say, what are you going to do about the Dickey Amendment? How is it possible that we can't get any federal funds? Because we get state funds, we get private funds, but without the federal funds, we're never going to be able to do the research, and we need to have the data. We need to show the data in order to make change. So we did, as the governor said, repeal the Dickey Amendment, but we still don't have the money for gun research. And we're going to do that. And the reason it's so important is because of what, again, the previous speaker said, which is we need the data. We need the information to make informed decisions. And I don't have to tell you that this is what the NRA and our opponents don't want. They don't want the facts. They don't want the science to come out. Just a couple days ago, I was over at Eagleton, and we had a meeting, a workshop with scientists, PhD candidates, professors, who asked me, how can scientists get more involved in public policy? That was the purpose of the workshop, a great workshop at Eagleton, another great thing at Rutgers. And I basically explained to them, how we could get the scientists more involved, and why it was so important. And that's why what you're doing is so important, because if, and I know I'm repeating, if the science is there and the data is there and the research shows what can make a difference, then, and the public is even more informed, then we will have more, information to battle those who do not want to see the gun safety measures on a federal level. And that's, again, why what you do is so important. I can't stress it enough. So thank you all. Thank you for inviting me. And I know this is just the beginning of a wonderful effort that's going to make a difference for our country. Thanks again.
Well, thank you very much. We are incredibly grateful to the leadership of Rutgers and the state for being here to kick off our event. So thank you, Chancellor Strom, President Barchi, Governor Murphy, and Congressman Pallone for your generous remarks and your continual support for the center. We're now going to shift, and I'm going to introduce the co-directors of our center, who are going to explain to you how we're organized and how we're actually going to do all the work that we've been supported to do. So without further ado, it is my great pleasure to introduce Drs. Bernadette Hull and Michael Osterman. Dr. Hull is an assistant professor of epidemiology in the School of Public Health and my colleague, and Dr. Osterman, associate professor in the School of Criminal Justice. So, Bernadette, Michael, please join me.
Bernadette is right there. She's going to come up in a bit. Thanks. Cheers. So good morning, everyone. My name is Michael Osterman. I am the co-director of the Rutgers Center on Gun Violence Research here in the great state of New Jersey. I'm also an associate professor at the School of Criminal Justice. I wanted to take this opportunity to genuinely thank all of the terrific speakers that we have already heard from, as well as our Rutgers leadership that allowed us to be here today to allow us to start this center. So thank you, Chancellor Strom. Thank you, Chancellor Cantor. Thank you, President Barchi, Congressman Frank Pallone, and particularly thank you to Governor Phil Murphy for your guidance, support, foresight, and helping to establish what is only the second university-based gun violence research center in the country. So a true thank you from myself and on behalf of the rest of the center leadership for helping to situate Rutgers and the state of New Jersey to become potentially and hopefully one of the leaders in gun violence research, education, and training in the country. I also, thank you. From a utilitarian standpoint, I also want to state that there are sticky notes in the middle of everyone's tables, so you can put questions on those sticky notes. We're going to have a Q&A later on in the agenda, so if you write down those questions there, we'll hopefully be able to address some of them during the Q&A. I want to bring attention to our newly launched website, gunviolence.rutgers.edu. And I also want to state that we are going to have a video on that website that represents a visualization, an artistic visualization of some of the major themes that we considered during our research, and that the video was created by Jeffrey Billingsley of the Rutgers Newark Communications team. And Mr. Billingsley has recently co-produced a documentary on gun violence in the Black community called Killing Beef. This documentary chronicles the journey of Samson Stiles, who's also the executive producer of the film. And the documentary communicates his attempt to find meaning in his life and reconciliation with his shooter, after recovering from a near-fatal gun violence episode. Mr. Billingsley is on our Training and Education Advisory Committee, which is headed by the very wonderful Elizabeth Sloan Power of the Department. There you go. She's from the Department of Social Work here at Rutgers Newark, and she's the center's Director of Training and Education. We intend on having talking tours with this documentary as a part of our training and education activities. That's all my homework is. So I'm a researcher. I'm a scientist. So my talk is a bit more data heavy. So why are we studying gun violence? Why study gun violence? Gun violence is one of the most pernicious public health, criminological, and sociological ills in American society today. Approximately 1 million Americans have died from gunshot wounds in homicides, accidents, and suicides during just the last 3 decades. And to put this number into perspective, this 1 million Americans that have died from gunshot wounds over the last 3 decades is more than the sum total of all combat deaths in all of the wars fought in U.S. history. That's a lot. So we see 2 bar charts here that communicate national trends in gun violence from 2010 to 2017. Since 2010, there have been approximately 279,000 firearms-related deaths in the United States, and this represents an age-adjusted rate of about 11 per 100,000 in our population. As you can see from these charts, about 61% of these deaths are from suicide nationally, 35% are from homicide, and approximately 1.5 are from unintentional violence. So in 2017, according to data collected from the Centers of Disease Control and Prevention, approximately 40,000 gun deaths occurred in the United States. This was almost as many gun-related deaths in the United States as there were motor vehicle deaths in that same year. And these death statistics are really just the tip of the iceberg, because tens of thousands more individuals each year are hospitalized for non-fatal gun injuries. So those numbers put the issue, I think, into a national level perspective. But what about New Jersey specifically? So the bottom bar represents New Jersey specific level data, trends from 2010 to 2017, firearms death in New Jersey. While New Jersey has some of the most strict firearms laws in the country, we're currently in 45th place for our death rate when compared to other states. Since 2010 to 2017, there's been approximately 3,800 firearms deaths in New Jersey. And this represents an age-adjusted death rate of approximately 5.3 per 100,000 in our population. But as you can see, New Jersey trends do not mirror national trends concerning the proportional representation of causes of injury-related death due to firearms. In New Jersey, about 2,200 of our total deaths across 2010 to 2017, or 60%, were gun-related deaths due to homicide. This represents an age-adjusted rate of approximately 3.3 per 100,000 in the population. About 40% of our gun-related deaths from 2010 to 2017 were due to suicide. So this represents about a 2 per 100,000. So you can see that when compared to national trends, New Jersey trends are kind of flipped. We have a 40% representation for suicides and approximately a 60% representation for homicides, while in national trends, there's a 60% representation in suicides and a 35 or so representation in homicides. Gun homicide rates, however, are not proportionally spread across New Jersey's population. When looking at these data from 2010 to 2017 and ascertaining homicide rates according to race and ethnicity, rates of Black non-Hispanic males, there's an age-adjusted death rate of approximately 32.4 per 100,000 across this time period, compared to a rate of less than 1 per 100,000 for non-white Hispanic males. When looking at 2016 data gathered from the CDC, Approximately 78% of firearms-related homicides in the state of New Jersey are black, and 20% are white. So to gauge some of the background opinions and views of New Jerseyans towards gun violence in their communities, we, the center administration, partnered with the Eagleton Center on Public Interest Polling at Rutgers University. Through our partnership, we developed gun-related questions that were posed to New Jerseyans. The poll was conducted between March 29th and April 9th of 2019, so this year. There was a yield of 1,008 New Jersey adults that answered the questions. And they used a random digit dialing probability sample, and they ultimately weighed the data from US Census parameters for the New Jersey population. So they weighed the data according to age, gender, education, race and ethnicity, and region. So the results that I'm communicating, or will communicate, are accurate within a margin of error of 3.5 plus or minus percentage points. So they fairly accurately reflect the opinions of New Jerseyans. So what did we find? We ultimately found we asked a lot of different questions, and I'm going to go over two of the major questions that were posed, or two of them that stuck out the most when we were looking at the data. So these questions include: how much of a problem do you think gun violence is in your local community? And how worried are you that you or someone you know will become a victim of gun violence sometime in the future? So the results of this poll ultimately communicated that 17% of New Jerseyans report that they or someone they know had experienced gun violence in the past 12 months. When posed the question, how much of a problem do you think gun violence is in your local community? About a third of New Jerseyans responded that gun violence was either a big problem or somewhat of a problem in their community. When posed the question, how worried are you that you or someone you know will become a victim of gun violence in the future? About half of the respondents indicated that they were either somewhat worried or very worried that they or someone they knew would become a victim of gun violence sometime in the future. So those are interesting in and of themselves. But when partitioning these data according to key demographic factors such as race, ethnicity, gender, income levels, education, and region, some very interesting trends emerge in these data, and ultimately communicates that the experiences and concerns with gun violence in New Jersey are significantly more prevalent among Black, low-income, and urban residents. So when partitioning these data, we found that 43% of Black respondents indicated that gun violence was a big problem in their community, and 12% indicated that it was somewhat of a problem in their community. This ultimately communicates that over half of Black respondents in this survey responded that gun violence in their community was either a big problem or somewhat of a problem in their community. 32% of Black respondents indicated that they or someone they knew had previously experienced gun violence in the past, and about 70% of Black respondents were worried about their future, like the future victimization of either themselves or someone they knew. When looking at income level data, we found that lower income respondents, defined here as less than $50,000 household income, this group was more likely to think that gun violence was either a big problem, 39%, or somewhat of a problem, 12% in their community when compared to other income levels. So again, this communicates that more than half of this group think that gun violence is either a big problem or somewhat of a problem in their communities. Within this income level, 64% of the respondents were worried about future gun violence victimization of themselves or someone close to them, and 22% had either directly experienced gun violence or knew someone who had. Respondents that indicated that they lived in urban areas were more likely to think that gun violence was a big problem, 33%, or somewhat of a problem in their community. This was 16%. 27% of these respondents had experienced gun violence or knew someone who did, and 60% were worried about the future. So with these findings in mind, It's our aim as a center to perform scientifically rigorous research of the highest quality in order to help adjust existing policies and programs and/or to create new ones, with the intention that our research will create safer and healthier environments for the citizens of New Jersey, and through our outreach, training, and education efforts to formulate actionable policies that can be exported to other jurisdictions as well. And with those things in mind, I'd like to introduce my esteemed colleague and co-director of the center, Bernadette Hull. Bernadette is going to go over the more specifics of the mission and aims of the center. She is an assistant professor of public health at the School of Public Health. So take it away, Bernadette.
Thank you. Thanks, Mike. So I would be remiss if I didn't thank everyone for attending and thank all of our leadership for all their really insightful words, both the leadership of our state and the leadership of our institution. And, you know, off the cuff here, I have to say that having traveled for events like these across states, across the country in the last few weeks, I've never been so proud to live and work in New Jersey based on the leadership that we've seen here today. So thank you to everyone. So I'm quickly just going to go through the vision and mission of the center so you can get an idea following off of many of the things that have been presented today. So obviously our leadership recognized a need for an independent source of information to respond to the ongoing epidemic of gun violence. And research, in fact, is a systematic way to establish facts and reach new conclusions. Go figure. Good research, though, can provide unbiased answers to important questions. You're going to hear more about this in our keynote address today, but I have to paint a picture of a public health approach so you understand the context in which we built the center. So gun violence is a public health issue. It is a health issue. It's a leading cause of death and disability in our country. It increases the risk of poor health outcomes. And it involves not only those people that are directly involved in gun violence, but also all the folks around them and the communities around them. It is not, sorry. So gun violence is not a random event. We know it's more likely for certain people in certain places. And public health approach seeks to address and improve the safety for all individuals by first identifying these patterns in our communities. It's the result of complex and varied causes that include factors at all of these levels, the individual, the interpersonal, the community, the societal levels. And public health realizes that in order to address this complex issue, we really have to address those factors at all of these levels, at each of these levels. And moreover, to be able to do that, we need public health utilizes the experience and the expertise of individuals across varied sectors, across very academic understandings, across stakeholders and varied experiences. And finally, we have to recognize that gun violence is not accidental or unavoidable, and it's not an isolated problem for just a few individuals. And public health approach recognizes the importance of moving upstream for prevention and including addressing complex causal issues like social determinants like poverty and structural racism that are driving factors for these issues. So the mission of the center is to provide high quality multidisciplinary research on gun violence causality and prevention and translate this research into clear, actionable policies and programs. Ultimately, we should just say we want to create safe and healthy environments. You know, short and simple. We'll do this by partnering with local, state, and national experts. We'll access data to conduct the research that identifies factors that I mentioned that are related to gun violence. We'll evaluate interventions to determine what works and translate science into effective programs and policies and ensure widespread adoption with our outreach. Again, in line with our principles of public health, the approach of the center is that it is multifaceted, multidisciplinary, collaborative, and supported by a rigorous evidence base. We understand that solutions require engagement from all stakeholders, and I have to add, most importantly, we've stood up here representatives of institutions and representatives of leadership in state and those institutions, but from my experience, my understanding is that the best way to identify solutions is really going from the ground up, and that we can learn best from the stakeholders that are closest to the lived experience of these issues. And so we truly believe that our approach will be collaborative and informed by those stakeholders. And I must say that we're going to focus on ways to reduce the incidence of all forms of gun violence while respecting the rights of legal, safe gun ownership. The structure of the center is basically here. It's jointly led by the Schools of Public Health and Criminal Justice, but it incorporates faculty from among Rutgers University's multiple schools and colleges and campuses that span across the state of New Jersey. It consists of 4 main components: surveillance, research, training and education, and outreach. And these activities are supported by an administrative core that oversees all of the work. Most importantly, is what I mentioned before, it's informed by stakeholder advisory boards, both scientific and what I call community science experts, and an executive committee from institutional leadership that help to make sure that we're meeting our mark. You've seen us enough. Michael and I are the co-directors of the center, representative of the jointly led efforts between public health and criminal justice. And now I'll just go into a little bit of very briefly about the approach for each one of the cores. So our research is really focused on being able to identify the nature of gun violence, including the individual and social determinants of risk for involvement in gun violence, whether it be for victims or perpetrators. It focuses on the individual, community, and societal consequences of gun violence, prevention and treatment at the individual, community, and societal levels. I hope you're understanding a theme here. The effectiveness of existing laws and policies intended to reduce gun violence, and the efforts to promote responsible ownership and use of guns. We'll do this by first setting an agenda with research priorities informed by all of our stakeholders. We'll continue to identify funding that will support the center and its mission beyond what the state is able to provide. We'll work with surveillance to use statewide data to generate research. It's in and of itself is a key achievement. We'll work with outreach to translate findings into actionable programs, and we'll generate research through an internal funding program that is on its way, and you'll hear from in a bit. The director leading these efforts is Dr. Paul Boxer, professor of psychology and the director for Center on Youth Violence and Juvenile Justice at Rutgers, Newark. Moving on to our surveillance component, this is a key component that's going to help to facilitate our linking data. Data is not glamorous and not very exciting to many people other than us research nerds, but the fact of the matter is that good data helps to answer questions that we have been trying to find answers for a very long time. And so it's fundamental and foundational that we are able to identify the important data throughout the state and link it and share the information that we learn to advance the state of gun research. Moreover, making recommendations on what data exists and how we might improve those data systems to inform our efforts. This is being led by Director of Surveillance, Dr. Stephanie Bonney, whom you will be hearing from in a few minutes. She's an assistant professor of surgery and the director of the HVIP up in Newark. Our outreach efforts hopefully many of you will continue to help us with our outreach efforts, being from various sectors throughout the spectrum of violence prevention. We'll connect state and local policymakers, community-based programs, and advocates with the expertise of the university faculty. But also by connecting them, we'll also have their engagement in telling us what it is they think that we need and how we might go about doing that. We'll also interface with state policymakers to inform them about the relevant research, so providing a feedback loop of information to create evidence-based policies. And this effort is being led by our Master of Ceremonies, I believe, and the Director of Outreach today, Dr. Michael Guzmano, who is an Associate Professor in the Department of Health, Behavior, Society, and Policy in the School of Public Health. And then finally, our training and education component. We'll focus on identifying best practices for gun violence prevention, working with stakeholders to identify educational needs and develop tools to be responsive to those needs, evaluating prevention program at each level of prevention, and preparing, most importantly, I think that this needs to be made really clear. Not only have we had a lack of funding to support research, which then creates a lack of research to support our understanding, it's created this massive gap in our ability to produce good research because we don't have people power. We don't have people with the knowledge and or interest or ability to do gun violence research. And so it's really quite important to be able to start building up those future leaders in this area by preparing students and trainees at all levels to be successful in their careers. And that effort's being led by our Director of Training and Education, Dr. Elizabeth Sloan Power, who I have to give a little plug to because, quite honestly, she was really one of the driving factors, and she's not going to put her face up here at all today, but she was really, so if you could give her a round of applause. I'm going to end with this, and this is something that you may not have realized or have heard before, but I think that this is something important for us to end this particular session on. Why a center? And I've been asked this multiple times. Why not just research? Do your research. Why fund a center, and why build the structure out this way? Well, because we have learned from leaders who have acknowledged that there's value in a center approach way beyond what could be done by just funding one independent project. And the opportunities that are presented by centers are opportunities that would not otherwise exist unless they otherwise exist through one individual research project. We can support a broad range of activities beyond just the one project. It gives opportunity for respectful, mutual, beneficial collaborations. And I say that because, in fact, it takes time to establish them, and center relationships are really able to do that and to maximize those relationships for multiple projects and activities. Because of what I just mentioned, it provides the ability to train future leaders. We're trying to be fiscally responsible, so in fact it does leverage many of the resources that are being provided to us. And it is, in my opinion, the most important way to be responsive to the needs of communities. We're not just doing a one-size-fits-all, and we're not doing it in one place for one group. We're really trying to acknowledge that people, as we've heard multiple times, our communities are varied, and our communities know what they need. And so being able to establish fundamentally a structure that supports our understanding of that is really being responsive to the issue of gun violence and reducing death and disability from that. So that's it. Thank you.
Thank you, Michael. Thank you, Bernadette. So we're going to hear from Dr. Bonnie in a moment with her keynote address. But before we do so, we're honored to have the Majority Leader for the General Assembly, Lou Greenwald, here with us today. As you know, Assembly Leader Greenwald has been a key leader in gun violence research. We had an opportunity to meet with him as our team, and I have to say it was refreshing to meet with an elected official who immediately got research. It was wonderful. So Assemblyman Greenwald, please join us.
Ladies and gentlemen, thank you. I'm going to be brief. This is such a wonderful day. It's a great day for Rutgers, really, in so many ways. I'm brief in large part because I'm leaving to go down the street, because one of my passions that we have worked on for the last 18 years is once again being acknowledged today. I'm leaving here to go to the Cancer Institute of Rutgers, where the National Cancer Institute is recognizing our Cancer Institute at Rutgers and putting it once again on the national designation, which is a remarkable achievement. And one of the reasons why I'm so passionate about going to that event as well is not just because we've worked on it for 18 years and we've learned the lessons, but I think it has a unique symmetry to what we're doing here today. And for those of us who have loved ones who have been diagnosed with cancer, we have this sense, you know, the big C and what it means. I think because of the work of so many people in this room, we now understand the disease and the illness of gun violence. And I think, you know, that big G is starting to have some resonance because of all these remarkable people with red t-shirts that have really crossed the state, and the Brady folks, and absolutely in purple as well. Some of you wear same color shirts as well. But I mean, it is a remarkable event which you have as a citizens movement made a difference and really covered the state to send a message that this can end. And you know, I was listening to the doctor, and you know, I found it humorous as she finished with, and that's it, as if, you know, that's the lunch order and that's it. It's so much, and her words really just should ring really through all of us and touch our souls, that this center is important. And why the center is important is because it is more than a research project. What this will mean, and similar to the Cancer Institute, by investing in this, New Jersey it's not lost on so many of you that are tied to our universities. We don't get our fair share from Washington for research grants and investment. This is an opportunity to make a leap in that as well. And the work that will be done here will not just benefit the people of New Jersey, but it will benefit people across this country. What we find, what we discover, what we uncover will benefit people across this country and help us understand why our country uniquely is touched by this violence in a way that no other place in the world is. And to understand the culture of what guns have been in our communities and in our country, and a way to do this better. And you know, that's why I'm so passionate about this, and I'm so thankful that I've been able to play a very small role in this. And to my friends in the Brady community, the Brady folks, when I got elected in 1995, this is the only office I've ever held. And when I ran in 1995, I wasn't supposed to win. And the only group that endorsed me in 1995 was the Brady Foundation. And I'm very proud that after all these years, we've come a very long way together. And I wouldn't have been able to do what I've done without you guys. And hopefully you see the ripple effect beyond just this one issue. And I'm very proud of the legacy and the history. So enjoy today. This is a remarkable achievement, a remarkable accomplishment. This is only the second state in the country that will have a center like this, second to California. We have both coasts covered, and it could not be in a better place than in Rutgers. And we're very proud to have it here at our state university. God bless you. Thank you very much.
So it is my great pleasure to introduce Dr. Stephanie Bonney. As you heard, Dr. Bonney is our Director of Surveillance, and she is also an Assistant Professor of Surgery here at Rutgers University. As many of you know, she is a leader in this field, and one of the great honors and privileges of being connected with the center is the opportunity to work with her. So for our keynote address, Dr. Stephanie Bonney. Thank you.
Thank you, everybody. And I think I'd like to echo everybody's statements to thank the leadership of Rutgers and the leadership of New Jersey for really seeing this come as a reality. I remember it didn't seem that long ago that Dr. Hull and I were texting each other like, did you see it? Did you see? There's a request for proposals. Let's do it. We're going to do it. And here we are today. So I'm really excited. This is my day job. This is a picture of me doing my day job, which is operating on a victim of gun violence up in Newark. I am a trauma surgeon. And I also want to give a shout out to my incredible partners, my group up in Newark, who are just really incredibly talented and really gifted surgeons, including my boss, Dr. Livingston, and Dr. Mosenthal, who have been incredible mentors for me since I've come here to New Jersey. If anybody's feeling a little rumble in your stomach after lunch, I can also take out your gallbladder, your appendix. You just come see me, got you taken care of. So November was a fun time. We got the center started, and one day my phone was just blowing up. And what ended up happening was I looked, and there I was on Twitter, people tagging me in their tweets saying, somebody thinks that gun violence is not your lane. You don't belong in this conversation. And I was like, what? I see that every single day. And myself and my colleagues responded to this. My colleagues from around the country responded to this and said, no, this is our lane. This is what we do. There is only 2 people in the world that can tell you the difference between what a handgun and what an AR-15 does to someone's liver, and it's me and the coroner. So I definitely belong having a seat at this table and in this conversation. And so we started posting some pictures, and we got a little traction, and the This Is Our Lane movement was born. And as we worked through that, we got a lot of more tweets that started, and they started to change. It wasn't the pictures of the emergency room and the bloody operating room floors anymore. It started to be about gun violence as a public health issue. But what does that really mean? What does it mean to say that gun violence is a public health issue? We've seen this before. We've seen a lot of people calling, many of you in this room, saying, gun violence is a public health issue. We need to address it and fund it like the public health issue that it is. But what does that mean that we do? If we all sit down in a room today with our pads of paper and we get going and decide, today we're going to do it, we're going to address gun violence as a public health issue, what would we be doing? So I think it's first important to talk about guns and violence and how they're different. So guns, there's a lot to do with guns that this center is going to study that is not necessarily intentional interpersonal violence. There's child access and unintentional violence, what we used to call accidents, but there's no such thing as an accident because everything is preventable. There's suicide by gun, children accessing guns, and there is gun violence that is intentionally perpetrated on an individual by another individual. But then there's violence, and there's a lot of violence out there that's not perpetrated with a gun. So there's violence that's perpetrated with knives, there's violence that's perpetrated with fists. We see all of that in the trauma center. And while they intersect and overlap, I think it's really important not to necessarily conflate the two. Okay? So violence is a public health issue and needs to be managed as a public health issue, and guns are a public health issue, and while they intersect, they are different. So what is the public health approach, and how is that different than what I do in the hospital every day? Well, I use a medical model, right? I see an individual who has a problem, and I reach into my medical toolbox, and I use the tools that we have in medicine to treat that individual in front of me. But public health is different. Public health is about working around individuals and treating populations with interventions that are really focused on prevention. And so it's very different than that sort of medical model in that it's population-based, and it typically involves, the government more and a little bit private, whereas the medical model is typically private. It's the relationship that exists between a doctor and their patient. And when we apply public health to injury prevention, we know that there's 4 phases. And so the first phase is what we call surveillance. And I actually don't really like that term, even though I'm the director of surveillance, because I think it sounds like I'm, have binoculars and I'm like looking into your window to see if you have guns in your house. That's not what I'm doing. Surveillance is about how we handle data. How do we handle data on a state level? The state data that we collect about hospital admissions, about acts, criminal justice, and how do we bring that data together to paint a picture of who's really at risk? We could put gun violence prevention interventions across the entire population, blanket everybody, but not everybody needs them. And there's quite frankly just not enough resources to do that. So how do we develop an approach where we can study what works best in what places and with what people so that we can target our interventions to be the most cost-effective and the most effective at saving lives? The next step in the public health approach to injury prevention is identifying the causes. So once we know something about the data, let's talk about why people are being injured. And then let's talk and research interventions. So we come up with interventions, things that we think might work to help solve this problem, and then we research them. We don't just put them out there because it's popular opinion. We're going to do research and find out what really works, because sometimes we're surprised and the things that we think are going to work really don't. And sometimes the things that we're really surprised about actually really do a good job. So we have to research that, and we have to have the data on the programs that we're implementing to do that. And you're going to hear a lot about that this afternoon, about how we can develop original research around this problem so we can develop meaningful interventions. Once we've identified interventions that work, we have to tell people. We have to let them know. We have to train trainees and tell them how we're going to help them build their careers around providing these interventions and studying them and refining them. And we have to let the public know, this is what we're doing. This works. So we want to put this out there for you. And this is like Public Health 101. So if you take any public health class, you're going to see what's called a Haddon's matrix. And this is the very beginning. We take that primary, secondary, and tertiary prevention. Primary prevention stops something from ever happening to anybody. Secondary prevention lessens the effect once it has happened. And tertiary prevention makes it so that once a disease or a problem is affecting a person, it mitigates how bad it is for that person. And then we put that in a matrix across, and across we say, look, there's the person that this is happening to, there's the vector or the host. Like, I usually think of hosts as mosquitoes, but that's because that's how we talk about infectious disease. But in this case, the host is the firearm. And then there's the environment. There's the physical environment. So that's things like green spaces and urban blight. And then there's the social environment. So what is happening in people's families and their communities that may be perpetuating or preventing firearm injury? And we know this works because the last century has seen a lot of really great public health achievements, right? So we've done incredible work in infectious disease and in car safety, so making motor vehicle collisions less deadly. We didn't take away anyone's car, but we did make you less likely to die if you're in a motor vehicle collision. And we did that using that primary, secondary, tertiary approach and applying the Haddon's matrix to motor vehicle collisions. And I recently, when I was preparing for this, I opened up one of my trauma surgery textbooks. And right there in the very first chapter about prevention, it said, we have been less successful in applying this model to gun violence for a variety of reasons. But that's what we're here to do today as part of this center. We know that one intervention isn't going to solve all the problem. There's just no one thing that we can do that's going to solve this problem. We need data to know what is possible, who's affected. But there's lots of possibilities, right? There's safety mechanisms like trigger locks and gun locks. There's things like violence intervention programs, whether they're in communities or as part of municipalities or as part of hospitals, that can help prevent violence that escalates to gun violence. There are gun safety education programs. So how do we educate people who are purchasing a firearm about how to store it safely in their home so that their child or their neighbor doesn't get a hold of it? There's mental health and suicide prevention programs. And we know that nationally, suicide is 2/3 of all gun deaths. So we have to address this. This is a huge problem. And then there's advocacy. So changing the culture and the way people think about firearms. And that's where many of you in this room come in and your incredible work in really changing it. You know, the motor vehicle collision deaths didn't go down without mothers and drunk driving. And just like that, there's a lot of mothers who are going to make a big difference. So here's how we've set up the center. So we have a surveillance core, that's me with my binoculars, looking at data on my computer in my office. And what we're trying to do is merge data sets. There's a lot of data that's being collected about people, but it's not necessarily accurate. It's not necessarily being collected in a really efficient way. And it doesn't tell us anything about other data sets that are collecting. So you have criminal justice data sets that are coming together with police data sets that are coming together with health data sets. And individuals may be in all three of those, but they're not linked. So we don't have a good picture about how we can create, what is this person and why are they at risk and how can we prevent that? There's a research core which will support investigators across Rutgers. We're gonna again hear about that more this afternoon, with original research and new ideas and fresh thinking about this problem. The training core is really going to be working on things like teaching our young folks how to develop a career around this problem. Going into medical schools and teaching, and nursing schools, and teaching the medical school students and the nursing students how to bring up gun violence safety in the confidence of that physician-patient relationship. Teaching our criminal justice folks how to develop policy that can be sensitive and thoughtful about this problem. And then there's the outreach core, which is about public messaging. It's about informing the other cores about what's going on and investigating public opinion. And it's no coincidence that these cores mirror that four-step approach that we talk about when we talk about the public health approach. So it's not an accident. This was built purposely for that reason, because we're taking a fresh look at gun violence really as a public health problem. So why fund research? Why research? How is research, how is me sitting with my binoculars in my office going to stop a child from being shot in Camden? Well, from data we know a couple of things, that gun violence spreads like a disease through populations, that people who are affected by gun violence tend to know other people who have been affected by gun violence. We know this from data from our own school at Rutgers, from really talented researchers who've been able to look at this and look at the way individuals are connected in communities and how gun violence doesn't just affect that one individual, but actually spreads and affects people who are connected to one another. The current statistics in the United States grossly underestimate the burden of non-fatal injury. We just actually don't know how many people are shot and live in the United States every year. We know how many people are shot and died, quite frankly, because it's not that hard to count death certificates. But we don't know how many people are shot and live. Well, how come? Because there's no way of reporting this in a regular way in data that is being collected together in one location. The National Violent Death Reporting System, which is about 10 or 12 years old, was actually a good leap forward because it told us a lot about the circumstances surrounding people who are dying. It's actually greater than 90% accurate in most cases. It's managed by the Center for Disease Control, and about 46 states participate. So that's a great resource for us. But again, it's only telling us about the people that die. And if you ask the CDC how many people are injured every year by a firearm and live, they will tell you that they don't know. And the margin of error for the CDC has gone up rapidly in the last couple of years. So much so that in 2017, what the CDC knows about gun deaths is that somewhere between 30,000 and 230,000 people were shot and injured in the United States, but we don't know what number that is. So if we don't know what the number is, how can we even begin to come up with ways to provide prevention to those people? Because we don't even know who the people are that we're supposed to be providing prevention to. So that's what we're going to do in New Jersey. We may not be able to do it nationwide because the funding just isn't there yet, but we can do that here in New Jersey as part of this center. We've already heard a little bit about the Dickey Amendment. In 1996, there was an amendment made to the Constitution that said that none of the funds made available to the Center for Disease Control and Prevention can be used to advocate for gun control. While the language was a little bit nuanced, what it was is that it created an effective moratorium on gun violence research as a health issue in the CDC, and the NIH followed, although they've come back from that a little bit. By no coincidence, the CDC budget was cut that year by the exact number of dollars that they had used to fund gun violence in the prior year. So it wasn't an accident. And what has ended up happening is that there's just maybe $100,000 to $200,000 available per year for gun violence research for the whole country from the CDC. That's almost nothing, especially when you consider how much the CDC budget has risen. And the effect of that has been that gun violence is grossly underfunded relative to the burden of disease, right? So if you have the burden of disease here across the bottom and the amount of funding across the y-axis there, then what you see is that if you're in that gray space or you're along that line, you're about proportionally funded toward your burden of injury. But you see gun violence is down here way at the bottom. And that means that we've grossly underfunded this problem relative to the burden of disease. Because we've grossly underfunded the problem, we don't have good data. We don't understand this problem. Researchers, as we learned, have been hesitant to enter the field. I mean, they have to keep their lights on and feed their kids. So they have to, like have money to do this research so that they can have careers. And so they've gone into other things, and really talented public health professionals have gone on to study other diseases because that's where the money was. Few private centers have been dedicated to gun violence research, who have created about 4 mentors across the country to mentor anybody who is very interested in this problem. We can all name them, and if you look at their papers, there are a lot of people who've been writing papers for the last 25 years, and that's it. That's all we've had. There should be thousands more. Despite a 2013 executive action by President Obama to effectively repeal the Dickey Amendment, which it did, and that was the result of the shooting at Sandy Hook, Congress has failed to appropriate the funds year after year after year. So the Congress controls the CDC budget, so even though they're directed to do it, there's no money made available. But we know that this would work. We know that it would work if we could do it. And we know this because of what happened with motor vehicle collisions. It wasn't one intervention that made motor vehicle collisions go down. And if you look at the number of deaths compared to the number of miles driven in the United States in the last century, the number of people dying in motor vehicle collisions has vastly dropped. And that's because we had child safety seats. We had engineering solutions. We banked curves on roads. We created better seat belts. We created passenger compartments that don't collapse. We improved the trauma system so that when people are in a motor vehicle collision, they can get to a hospital quickly in the golden hour that we can save them as trauma surgeons. So what are we gonna do with all that data? So we're collecting a whole bunch of data in New Jersey. We're doing Eagleton polls. We're gonna bring together data sets. What are we gonna do with all of that? Well, one of the things that we can do is some geospatial work. We can see, this is a heat map of Newark. This was developed by one of my partners up at New Jersey Medical School, looking at all of the trauma patients that came to University Hospital over a 16-year period and creating a heat map of Newark. This is by census block, and we can actually do much more sophisticated geospatial work with really interesting technology, much of which has been developed at the School of Criminal Justice. This geospatial work will tell us what are the neighborhoods that we need to be going to put our violence prevention programs down. What are the neighborhoods that we need to be going to teach firearm safety, to talk about safe storage of weapons. We can develop literature. This is literature developed by the American College of Surgeons. We know from data and from research what is good for safe storage, what kind of storage practices are important. In your home, if you have a firearm, your firearm needs to be stored unloaded and locked, and it needs to be stored separately from the ammunition, which is also locked in a separate lockbox. That's a safe way to store firearms in your home if you have children in the home, if you have people who are suicidal in the home, if you have people who are elderly and maybe have dementia in the home. For all of that, that is safe storage. So we know that, and we can develop this kind of literature, which we can then put out through our university, through our practices in medicine, and through all of the other ways that we interact with the community as a university. We can develop public service messaging. This was developed in Utah when they looked at their data and found out that for people who commit firearm suicide by firearm, many of them had been in a gun range, like pretty recently, practicing with their guns. So they developed a public service announcement with this man who's practicing his target shooting at a range, puts his gun down and says, I was feeling really depressed a couple months ago. My friends came and they just took my guns out of my house for a couple weeks while I got things figured out, and I think they saved my life. That public service message was put out in the gun ranges where we know the people who are at risk of suicide are. That was all informed by data. Violence itself, we can better study and understand. We know that violence is a public health issue. It is public health and population-based, and it is based in the mitigation of risk factors and the enhancement of protective factors. Violence affects families, communities, the individuals, and we can look at these root causes for violence, interpersonal violence that's committed from one person to another, and we can work on mitigating some of these causes. Well, what are those causes? Some of it has to do with, the normalization of violence in communities and in families. Some of it has to do with policies and how we can create better policy and policing solutions. Some of it has to do with the way that we prosecute crimes. Some of it has to do with supportive and protective environmental factors. And all of that is worthy of study, and it's only in a multidisciplinary institution that we have experts from all those fields who are able to study that. So who specifically are we going to help? Well, really everybody, but there are some certain populations that are at risk that we're going to definitely work on as part of our research agenda. One of those populations is women. There is a huge problem in the United States with domestic violence. So domestic violence kills more women in the United States than it does in any other developed country. And a lot of this has to do with what we call means access or lethal means access, which means having a firearm that's available in a home. In fact, if you take 2 homes where domestic violence is regularly occurring and you put a gun in one of those homes, the risk to the woman's life in that home increases by 500%. So we are failing our women by giving lethal means access to their abusers. We're going to help children. Firearm death is the #2 leading cause of death in children in the United States under the age of 18. This is a uniquely American problem. This is not something that affects children in other countries. American kids are 12 times more likely to be killed by a gun than a child in any other developed country in the world. And American children aged 5 to 14 are 17 times more likely to be murdered by a gun, 10 times more likely to die by suicide, and 9 times more likely to die by some kind of unintentional firearm injury or previously accident than anywhere else in the world. African American communities, as we already learned, Black youth are 10 times more likely to be murdered with a gun than white youth. And the rate of firearm death for Black males aged 15 to 19 is 4 times higher than the national average for non-Black male youth, which is already much higher than it is in the rest of the world. So we're specifically going to look into what we can do in these communities. And mentally ill, there's this misnomer that those who suffer from mental illness are more likely to become perpetrators of gun violence. This has been put out in the media a lot when it comes to mass shootings. And while that may or may not be true, we don't really know. What we do know is that those who have mental illness are far more likely to become the victim of an act of gun violence than they are to perpetrate an act of gun violence. And then if you look on top of that at the rates of suicide, we know that half of all suicide deaths are completed with a firearm, and that if the population levels of guns in a particular area are correlated with the level of completion or successful suicide in those places. So we know that in states where there are just more guns out in the population, that they have a higher rate of firearm suicide. So these are some of the things that data can tell us. A lot of people, the misnomer with suicide is, well, if these folks didn't have a gun, they would find another way. And that's actually not true. So for those who survive a suicide attempt, greater than 80% will never go on to make a second attempt. And for those who do make a suicide attempt, more than half decided within 30 minutes of their attempt that that's what they were going to do. So we know that access to lethal means is a problem. Here's where we can work with education, and we can work with access and safe storage. Finally, we're going to help all of us. We're going to help our bottom line. The economic costs of gun violence in the United States are incredibly high, upwards of $230 billion a year in costs in the United States just in gun violence. That's about $12.8 million a day, or about $700 per American per year. It's $1,400 if you live in Wyoming, so be happy that you live here in New Jersey. Why is it so expensive? I mean, the hospital costs are expensive, but it's not just about what happens in the hospital. It's about the effect to the community, the associated criminal justice costs. It's about the cost of lost work, the lost work that those individuals are no longer able to perform, or the death and the disability that comes with all of that. And then it's also about the economic cost to businesses. Having gun violence near you is bad for business. Here in New Jersey, we spend about $3.3 billion per year on the economic cost of gun violence. And while only about $83 million of that is in direct hospital costs and another $131 million in policing, we see a ton of costs in terms of lost work, lost productivity, and the effects on families and communities as they learn to cope with this problem. Well, doesn't prevention cost something? So how is prevention going to lead to decreased cost? Well, it's just really a basic cost-benefit analysis. We, at the center here in the research, don't cost anything close to what we're already paying in New Jersey alone for gun violence per year. We can identify the highest risk individuals for suicide, for interpersonal violence, and for child access or unintentional injury, then we can provide interventions that are targeted at those individuals. But we can't know who those individuals are until we have the data. Once we provide those interventions, it can be in the form of education, it can be in the form of violence prevention, or it can be in the form of safe storage, all of which are really low cost and high fidelity solutions to this problem. Also, who cares about the cost? Prevention is just the right thing to do, no matter what the cost is. So here at the New Jersey Center for Gun Violence Research at Rutgers, we are going to be using a public health approach to prevent gun violence. We will develop interventions and research based on available data and novel and new research. We'll leverage the resources of the largest institution here in the state to advance a multidisciplinary approach to this problem, and we will ultimately be creating healthier and safer communities here in New Jersey. Thank you.
Thank you, Dr. Bonnie. As always, her words are both sobering and inspiring. So I have three bits of good news. The first bit is that we're not done yet. We still have more to come. The second bit of good news, maybe even better, is we're actually going to let you eat. And so we'll have lunch in just a moment. We're going to take about a 15-minute break. So the boxed lunches are in the back of the room. So I will invite you, once I'm done speaking, to get up, grab your lunch, get back to your table, and then we're going to have a wonderful panel of researchers from Rutgers who are going to tell you very briefly about some of the exciting work that they're doing. Third bit of good news is we really do want to hear from you. We're going to have a brief period of time at the end for some Q&A. As my colleague Mike Osterman mentioned earlier, you have sticky notes on your tables. Please write down some questions so you can keep them fresh in your mind, and we want to hear from you, and it'll be the beginning of what we hope will be a long conversation with you over the years. So please help yourselves to lunch, and we'll see you back at your tables in 15 minutes. Thank you.
All right, we're back. We're back. We're back. I don't know if anyone actually specifically mentioned the hashtag, but those of you who are on Instagram or Twitter or Facebook, please use our NJGVRC hashtag. Maybe we'll make it to Twitter trends or something like that. That'll be fantastic. Hello, everyone. I would say good afternoon, but it's not yet good afternoon, so I'll save that for a few moments from now. My name is Paul Boxer. I am the research director for the Center on Gun Violence Research at Rutgers. Thank you. I am also a professor of psychology on the Newark campus. Anyone in here in the house from Newark? Thank you. Love it. I love it. Okay, so there's actually there's sort of a secret leadership member-only version of the agenda that includes notes for the things that we're supposed to say and how we're supposed to say them. And I think my responsibility was to rally everybody after lunch. I don't know any cheers except for the ones that my daughter's softball team uses. And I don't think anyone's facing down a 3-2 count right now, so I'm going to hold off on that. Although I'm happy to do that for you later if you're interested. So I'm the director of the Research Corps, and with that privilege, I get the chance to really try and promote research related to gun violence around the university, leveraging the vast expertise that we have on the Rutgers University faculty to do that. I'm going to talk very briefly about the kinds of things that the Research Corps is meant to do, and then I'll ask our panelists to come up and we'll start that process. So a few folks who've presented already have talked about what the Research Corps is meant to be. we have a few broad goals in mind. One is to promote collaborative research activities and networking related to research within and beyond Rutgers University. So Rutgers University is an enormous university. We have the 3 big campuses, and we have a lot of satellite centers around the state too. So there's certainly a lot of networking to be done in that regard. But beyond Rutgers, a few presenters have acknowledged the importance of leveraging our community partners, state agencies, and other community agencies and offices to promote this kind of research. Our second big goal is to develop and support a network of Rutgers faculty affiliates to advance the center's research enterprise. We're trying to accomplish a lot, and we won't be able to do it without faculty experts on board. And finally, we are in the process of implementing a seed funding program for Rutgers faculty that is designed to launch center-affiliated research projects and external funding proposals. And those of you who have ever been engaged in the process of writing external funding proposals, you can commiserate with me right now because I have one due on Monday that I'm not working on at present. Okay, so that's the research core. We're going to try to do a lot, but we have excellent resources that have been set out for us to do that with. And what I'd like to do now is present to you our gun violence research panel from Rutgers. So if my panelists could come up and grab a chair, walk through this. Please come on up, come on up. The stairs are on this side. You're welcome to hop up, but the stairs are over here. Oh, there you go. Nice. All right. Excellent. So credit where credit is due to these folks. There was a short notice that I put out for faculty affiliates to put together a presentation on their work and come and talk to you all today. The timing was locked in. The day was locked in. So folks had to conform to some pretty tight deadlines, and these 5 were able to put that together. So I'm going to just quickly run through the list, and then each person will come up, present their work. I may ask them a question or two afterwards, but please, as we noted earlier, if you have questions, please jot them down. There's Post-it notes on your table. At the end of the whole panel session, we'll do a larger Q&A that my colleague Michael Guzmano will moderate. So today we have Shireen Rizvi from the Graduate School of Applied and Professional Psychology at Rutgers in New Brunswick, also known as, I was going to say GZAP. Richard Stansfield from our Department of Anthropology, Sociology, and Criminology in Camden. Joe Pasquarella from our School of Criminal Justice in Newark. Valerio Batchak from our School of Criminal Justice in Newark as well. And Ping Shin Chen from the Department of Family Medicine, Robert Wood Johnson. No, New Jersey Medical School, sorry, in Newark. So our first, and they're going to be presenting in this order. So I'm just going to step aside and invite Shireen to come to the podium.
Great. Thank you. It is a privilege to be here and telling you all about some of the work that I do across the river on Bush campus over there. And actually, I wanted to talk specifically about how gun violence can be reduced by targeting and addressing suicide risk. A couple of the presenters already touched upon some of my intro points, so that will allow me to go a little bit faster in that regard. So in terms of guns and suicide, you saw some data on this already, and the data suggested that in the nation, 60% of gun deaths are suicides. And I think that just to underscore this point, this is not what we often hear about in the media. Mass shootings obviously get a lot of public attention and awareness, and for good reason. And I would argue that suicide does not get the same amount of attention in the media, and yet the numbers suggest that more people will die by suicide than by a mass shooting event. Just to put it in perspective, there were approximately 45,000 suicide deaths in the US. This is data from 2016. As already referenced, 51% of this was by firearms. Very interesting. If you look at it from the point of view of suicide attempts, firearms are actually used in less than 5% of suicide attempts. So do the math on that. What that means is that when somebody attempts suicide by firearms, it is far more likely to be lethal. So 85 to 95% of all firearm suicide attempts are lethal, and just by point of reference, compare that to 2 to 3% of overdose suicide attempts being lethal. And the data suggests that access to firearms is a major risk factor for suicide. Homes with firearms in them are 5 times more likely to have, suicide is 5 times more likely in homes where there are guns than in homes where there are no guns. So just to have that be background information to talk about treatment for suicidal individuals. There are a number of evidence-based interventions that exist, and a common theme in all the interventions that have been shown to reduce suicidal behavior is that they involve means restriction, which essentially means taking away, identifying and taking away preferred methods for suicide. So just to give you a little snapshot of some of the interventions that have been studied and have been found to reduce risk of suicide, there are, and they vary in terms of the degree of intensity of the intervention. So for example, safety planning or lethal means counseling is a very brief intervention, sometimes just one session, where the intention of the intervention is to work with the person to remove their access to lethal means. And that's essentially it. And it has a profound effect on reducing suicidal behavior. Then you can go up the ladder to more intensive interventions. The collaborative assessment and management of suicide, otherwise referred to as CAMS, is approximately 4 to 8 sessions of individual treatment. There's brief cognitive behavioral therapy for suicidal individuals. That's approximately 12 sessions. And then the treatment for which I study is known as dialectical behavior therapy, that was designed specifically for individuals who meet criteria for a disorder known as borderline personality disorder, for which suicidal behavior and non-suicidal self-injury is actually a criterion. So despite the fact that we actually know that there are a number of mental health interventions, and when I'm describing this, I'm essentially meaning psychosocial interventions that have been found to be effective, that we do know that the vast majority of suicidal people do not receive any of these interventions, and the vast majority of mental health workers, so psychologists, psychiatrists, social workers, master's level counselors, do not receive training in them. So this is a real problem for many reasons, but it's particularly a problem for suicidal individuals who present for treatment not receiving the help that they need. So one teeny tiny attempt to address this problem is done in my clinic, which I direct over on Bush campus, where I run the Dialectical Behavior Therapy program, where we provide evidence-based psychosocial treatment to individuals. We actually just expanded to include an adolescent program, so we now treat individuals as young as 13 and their families through adulthood. Of the people that have come into our clinic for treatment, 60% of them have a history of a lifetime suicide attempt. 83% of them have engaged in non-suicidal self-injury at some point in their lifetime. So this is often seen by many people as cutting or self-cutting, as well as overdoses or other non-suicidal self-injury. One of the largest risk factors for suicidal behavior and suicide attempts is actually having a history of non-suicidal self-injury. So this is a really important figure. And we do ask people when they come in what would be their preferred method for suicide if they were to attempt suicide. And of the sample that we see, 22% list guns as the preferred method for suicide. So one of the things that I want to actually underscore as it relates to my clinic is that the therapists who do this treatment, this pretty intensive treatment with a pretty intense population, are all graduate students and are all psychologists in training. And I think that this is really important because actually psychologists are a nutty group. I am one, so I can say that. And we have a lot, there's a lot of leadership of psychologist training who believe that actually people in training should not be exposed early on to quote unquote difficult populations. And people who are suicidal, by definition, fall into that difficult population. And so we have actually a training structure where we say, most people say, that if you're in training, you shouldn't be exposed to working with individuals who are at high risk for suicide early on in your training. And I think that this is actually a major mistake, because if we can introduce people to evidence-based treatments for suicidal behavior earlier in their training, they are more likely to adopt those practices and are more likely to be willing to treat suicidal people throughout their career. So we have it lopsided, and I think that it's really important that research such as the research that I do addresses trainees as a target for what we're doing. So in terms of what needs to happen for addressing suicide risk, I think globally we need to, and nationally, we need to talk about increasing access to evidence-based, and these are primarily cognitive behavioral interventions. We need to increase training to clinicians in evidence-based interventions, and we further need to ensure that well-intentioned policies, or policies in general, are based on research and don't have unintended negative effects on risk. And so I'm going to say something controversial because I think it falls into this last category here. New Jersey recently passed a number of laws and amendments to laws to reduce gun violence, and entirely well-intentioned laws. One of those laws now says that if you have somebody who appears to be at imminent risk for suicide, you need to notify the police in that person's community so that they could determine whether that person has any access to guns. And I think that on the surface, this seems like a very wise and compassionate policy. What we don't know is whether this law has implications for who comes forward to express their risk for suicide and who is willing to disclose that they are suicidal. And so I think we need research to really investigate what the effects are of our policies and whether we can change our policies to match the best of evidence-based treatment. So thank you very much for your time.
Shireen, thank you. One quick question. The kinds of treatments that you're talking about doing in your clinic setting seem very intensive. They're clinic-based. Are there other interventions that are similar that have been adapted to other community settings, such as schools, hospitals, emergency rooms, et cetera?
Yeah, so it's a great question. I think, of these different interventions that I listed, they vary in terms of the intensity. Even dialectical behavior therapy, which is a more intensive psychological treatment, has been studied in much briefer and more adapted versions. And there are actually prevention programs based in schools that include dialectical behavior therapy, which a large component of DBT is what we call skills training, where we teach people how to learn skills to regulate their emotions, to tolerate distress, to interact more effectively with people to get the help that they need. And these skills have been found to be highly effective across a number of different populations and disorders. And so you see it being rolled out in many different places.
Great. Thank you very much. Next up, Dr. Richard Stansfield.
All right, thank you everyone for having me. I'm very happy to be representing Camden today. This is my Camden accent. I'm going to be talking a little bit about intimate partner homicide. So we know that about 60% to two-thirds of all people killed by their intimate partners are murdered with a firearm. Studying this relationship, typically people look at how the guns were obtained illegally, or how the presence of a gun already in the home tends to increase the risk for intimate partner homicide. My focus is a little different. It's focusing on legal firearm stores. So gun stores, pawn shops, big box stores like Walmart, pro-bash shops. And there's a number of reasons I think just the presence of a gun store close to the home might relate to intimate partner homicide. Very quickly, it might increase the risks that someone purchases a gun preemptively, especially in an urban area where there's a high rate of violence. There might be greater pressure and need to buy a gun for protective purposes. More gun stores close by, it might increase the risk that someone purchases a gun reactively, so people have less time to cool down if there's an altercation and there's a gun store nearby. And there might be more illegal guns in an area where you see more legal gun stores, whether through gun store robberies, straw purchases, or other means. Okay, so I wanted to look at the intimate partner homicide rate across the country. So this is using data from 2010 to 2016 from the CDC's National Violent Death Registry system. This is the rate of intimate partner homicide across these years, justified by the fact that Alaska is lit up in red. We see that rural counties tend to have higher rates of intimate partner homicide. If you focus in on New Jersey, compared to other states, New Jersey, of course, does a little better. But even within the state of New Jersey, there is variation county to county. So interestingly, both Atlantic and Cumberland County have both the highest rates of intimate partner homicide in general and intimate partner homicide perpetrated with a firearm specifically. Okay, so I wanted to understand what the role was of legal gun stores in these areas, controlling for a lot of different county-level predictors, poverty, disadvantage, as well as state-level variation in policies which are designed to keep guns out of the hands of people with a domestic violence history. So whether that's universal background checks or whether it's specific provisions about dispossessing guns from people with a history of DV. Okay. The findings actually produced a really robust relationship between the density of federally licensed firearm dealers with intimate partner homicides perpetrated with a firearm. It didn't really matter whether it was all incidents, female victims, male victims, young, old, black, white, Hispanic. It was a very robust relationship. The big nuance found in this data was that the findings were really limited to urban counties. So the presence of legal gun stores in an urban county significantly increased the incidence of intimate partner homicide. That relationship did not exist in rural counties. Maybe because there are more guns in circulation in rural counties already, and so there's less reliance on the legal gun store. One other finding, counties in states with more policies designed to keep guns out of the hands of DV perpetrators did a little better. They had lower incidence of IPH. But these policies didn't actually change that relationship between the legal gun stores and the intimate partner homicide. There was no moderating relationship. One final finding, which I thought was interesting and worth noting, the CDC's data set does have a variable which they call gun narrative. So in some instances, the law enforcement notes include details on the history of the gun. Okay. In some of these cases, there was anecdotal evidence that the gun used in the homicide was purchased weeks, days, sometimes even hours before the event. Okay? That feeds into the theory that I'm thinking through here. The problem is that that data from the law enforcement was missing in the vast majority of cases. So perhaps more than anything else, this research really taught me that much better and more consistent data is needed to actually track the journey of the gun from a store to being used in an incident. Thank you.
Thank you for that. So that's a great use of some big data resources that were already in play, and I'm curious to know what are some of the next steps in trying to quantify this relationship?
Yeah, absolutely. So Dr. Bonney actually brought up geospatial mapping earlier. With a couple of colleagues of mine, Beth Griffith at Newark and Dan Semenza in Camden, we're actually already working on looking at the police data in Newark to map out where not just homicides, but also non-fatal incidents occur, and actually look at the spatial proximity to legal gun stores. Really one of the first steps in this research is just mapping where both the incidents and legal guns are occurring.
Great, thank you.
Thank you.
Okay, Joe Pasquarella, please come on up.
Good afternoon, and thank you. Prior to the center, a team. I'm Joe Pasquarella. I'm from Rutgers School of Criminal Justice in Newark. Prior to the center, a team of ours up in Newark, we did a lot of research in a program called Operation Ceasefire in Newark. It had a lot of success in previous cities, in Boston, in Chicago, and we looked at it in Newark. We looked at it very in depth. We took a real deep dive into, whether this program, it involved resources from the criminal justice system, outside of the criminal justice system, basically, to curb violence right after it happened. And we looked at the results, and the results were a little mixed in Newark. And, I was always, questioning, what was going on in Newark that, was happening in these other cities. And, the center started, and I thought, here's a great opportunity to maybe compare Newark, where Newark is, comparing to other cities and cities in New Jersey and the rest of the country. So prior to, as our work begins to evolve at the center, I wanted to get a very, very long-term sense of homicides, and then, this emergent problem of the percentage of firearms homicides. And, as Dr. Bonney stated previously, the data out there is not as good as you would think. The problem is very, very seriously, and, there's really just not a lot of good sources of data. And time-wise, it doesn't go back very, very far. And a lot of findings that we have, you always see it in the literature within the last 3 years, within the last 5 years. And homicide is actually a problem that develops over a very, very long term. It actually developed over a couple hundred years here in the United States, and as you can see, the current iterations with the rise in mass shootings, it's getting more serious in the terms of firearms. So I wanted to look at, long-term data, and there's not a lot of good sources there. So the best source, I came up with is something called the supplementary homicide reports, and it's something that the FBI collects every year, and it gives you about 50 or so variables about the circumstances involved in each homicide, as opposed to just a hardcore rate number. And it gives you the age of the perpetrator, the age of the victim, the weapon was used, and typical circumstances. So it gives you a good qualitative dive into that. The only issue with that is it takes a couple of years for the FBI to, to collate all that. So, there's always a few year lag. So the deepest it goes back is to 1976. So I analyzed the data going back to 1976, and I have a few lines up there. The first is the blue line, and that's the rate of homicide in Newark. And all the way at the bottom is, I guess that's yellow or gold or canary. I'm an 8-crayon box guy, so I'll just call it yellow. The numbers on the right, that's the rate of homicide. That goes from 10, 20, 30, 40, 50, 60. That's the rate of homicides per 100,000. So the gold line at the bottom, that's the rate of homicide in the United States. And it went from about 10 to 1976. 80 was a peak year, 1990 was a peak year, and it went steadily down. So basically, it decreased throughout the rest of the country, about 50%. That's pretty good news. As you could see, the top line blue is Newark, and it's actually, I'm not sure if it's good or bad news. There's never good and bad news when it's talking with homicide. The better news is we're trying to get that number to decrease. And as you could see, we've had, fits and starts in Newark with success. And where we're trending are right now, we're pretty steady, but we have a lot of downside room to go in Newark. And the red line right there, that's Jersey City, New Jersey, and you could see the trends there. A little lower, but it's trending in the right direction going down. And the green is Paterson, New Jersey. These are our 3 largest cities in New Jersey. Newark's our largest city, maybe or maybe not going to get overtaken by Jersey City. They're very close. They're around 270,000 in population. And Paterson's been about 140,000. These are our top 3 cities. So it's not atypical to have your largest cities as the highest rate of homicide. However, I wanted to look at these large programs that went involved as far as targeting homicide. What's going on in these cities? What are these cities doing about it? And the first biggest program, 1994, was something called Jersey City Problem-Oriented Policing, where they took 6 very high violence-prone areas in Jersey City. And what we tend to do, unfortunately, in criminal justice, we don't handle failure well. And I'm finding now, studying this for 35 years, we handle success worse. So it was actually a relatively successful program. And what happened to it? It just maybe lost funding, but it did do a good short term. And the next large program, like I said, was Newark Ceasefire. We started that in about 2005. and the follow through on that in different iterations. The only program still active right now in its present star form is Patterson's ceasefire, which is a little different version. Not all versions of ceasefire are the same. Nonetheless, I just wanted to start as we move forward to take components of any type of intervention, what is successful about these programs. And then the next thing I looked at, percentage of homicides in each of our 3 major cities when compared to cities in the United States that are actually very similar to Newark, Jersey City, and Patterson. And once again, you could see the percentage of firearms in the United States is steadily rising. And then, however, in Newark, it's rising significantly. Going back about 43 years ago, in 1976, about 50% of the homicides in Newark were completed by a firearm. Today, we're almost approaching 90%. And we're going all 3 directions in our cities. So it's an interesting dynamic where, homicide is trending down. However, the percentage of homicides committed by firearms are going way up. And I'm not trying to say this is good news, but as a researcher, I'm seeing this as an opportunity where if we could, our work in the center, if we can get to these firearm suicides, as you could see, it's a very, very high percentage of homicides. If we could get at, what's going on with these firearms homicide, we could significantly lower homicides as a whole going down, moving forward.
Joe, so you've been looking at data like these for quite some time, and I'm curious to know if you have some thoughts about what might account for the higher rates of homicides in Newark compared to the other 2 cities, given that those are rates and not just raw numbers.
I actually think it's a complex factors. I think in Newark it could be related to prevalence of gang homicides are very high. We have to look at that, those confluent factors. It could be the drug networks. It could be a lot of different things. But I think it could be related to other criminal activities.
Great, thank you. Okay, moving on to Valerio Bacak.
Good morning, everyone. My name is Valerio Bacak. I'm an assistant professor at the School of Criminal Justice in Newark. This is my Newark accent. So today I will tell you a little bit about an ongoing project that examines the quality of data, media-based data and crowdsourced data on police officer-involved shootings. And this is joint work with 2 graduate students, Joshua Mausol from the University of Chicago and Christiana Schwartz from Rutgers University in Newark. As many of you in this room know, there are very few, if any, systematic official efforts to collect data on police officer-involved shootings in the United States. There is variation across states. Some states do a better job at it than others. But in general, we have very little good data about how many people are killed by police, and as importantly, how many people are shot and not killed by police officers. So in the place of official data collection efforts, media-based and crowdsourced data are increasingly used for research and policy purposes. For one, to simply count the number of people who are killed by police, but also to understand if there are any patterns in officer-involved shootings. However, the existing data collection efforts are really only focused or mainly focused on shootings that resulted in fatalities. So for instance, one of the sources that I'll mention today, the Washington Post, according to them, so far this year, about 300 people, 286 people have been shot and killed by police officers. The problem that I think is really big and that we haven't really addressed as researchers enough is that we know very little about officer-involved shootings that did not result in a fatality. And this is a big part of the motivation for this project. So in brief, what we are doing is we're taking data from police departments on officer-involved shootings, and then we're comparing these data to media-based and crowdsourced data sets to assess to what extent these unofficial data sources are accurate and comprehensive in capturing officer-involved incidents, shooting incidents. So here we covered, so far we've covered 2 media-based data sources that we know are fairly comprehensive in their collection of data. These are the Washington Post's Fatal Force database, the Guardian's Counted, and we also looked at data from Deadspin, which is the only one that has collects data on non-fatal incidents. And then we compared these data to official data from so far 5 police departments across the country that made their data available. These are Dallas, Denver, Jacksonville, Orlando, and Knoxville. All right, so I'll show only these results that I hopefully conveyed this main message of the findings so far. So what we find in general is that the crowdsourced and media-based data sources do a fairly good job of counting incidents, fatal incidents that involve police officers. So if we move from left to right, we see that the match rate for the Washington Post data set is 86%, and for the Guardian's Counted database, it goes up to 97%. So really, we can use these data sources for research and policy purposes in the absence of really scientific or official data sources. Deadspin is the only fully crowdsourced data set, meaning that the data on officer-involved shootings were not collected by journalists, but they were exclusively collected by citizens, meaning they identified the police shootings and they recorded them in the Deadspin database. So for them, they have a lower rate of counting fatal incidents. But what the value of Deadspin is they collect data on non-fatalities. And here we see that the rate of non-fatal incidents that are captured in Deadspin is only 8%. So the take home here is really that we can rely on these unofficial data sources because they are successful at collecting data on police officer shootings, but we know very little about non-fatal shooting incidents. Even though they're much more prevalent and they may have really great implications for public health and law enforcement. And I think, and many researchers in public health think as well, that they deserve more attention. Thank you.
Valerio, thank you for that. Can you say a little bit more about sort of what your sense is of the consequences of our lack of knowledge regarding those non-fatal shootings, with maybe some more specifics about how that could impact public health as well as law enforcement?
That's a really good question. I think one of the things we also know about a fatal officer-involved shootings is that we have a good sense of some of the circumstances that surrounded the race of officers, the race of victims, where the shooting happened, and so on. With non-fatal incidents, we don't know only that we have very little data about the counts, but we also know very little about the circumstances which led to these incidents. And without that information, it's going to be very hard to create any types of interventions, whether it's from the side of public health or law enforcement, to prevent them happening in the future.
Great, thank you.
Thank you.
Okay, we have one more presentation. Keep hashtagging. Ping Sin Chen, please come on up.
Thank you. Before I start, my name is Ping Chen. I'm an associate professor in Rutgers, New Jersey Medical School. It's in Newark. So before I start, I want to thank my colleagues in the department. This is really a group effort. So I'm going to talk about talking to patients about domestic violence and gun safety. So how many of you know someone who has experienced domestic violence? You know, I usually start my talk with this because I think that I am hoping that the first take-home message for today is that domestic violence is underreported. And I think that in previous presentations by Dr. Bonney and also some other colleagues here, they mentioned about the relationship between domestic violence and gun violence. So in the US data, gun-related domestic killings increased by 26% from 2010 to 2017. This was actually published in New York Times 2 weeks ago. And in 2017, about 61% of women murdered by partners were killed with guns. And from New Jersey police data, it showed that on average, 143 complaints of domestic violence by firearm reported per year from 2005 to 2016. So this slide shows my work in domestic violence. I graduated from Rutgers a long time ago. My dissertation was on domestic violence. My advisor, Helene White, introduced me into this field. So after graduation, after joining Department of Family Medicine in New Jersey Medical School, I started to think about how to work with healthcare professionals to help domestic violence survivors, how to help them. Back in 2004, domestic violence, when the United States Preventive Task Force did not recommend screening for domestic violence because there was no sufficient evidence. So then we did some studies funded by American Academy of Family Physicians and NIH to do some case control studies and a cohort study to identify screening tools that we can use in the clinical office to ask patients about domestic violence. Then afterwards, I spent much time in teaching providers, residents, and medical students on how to screen for, how to talk to patients about domestic violence, how to talk to them in a short doctor's visit. But then I found that actually many patients, they probably do not want to disclose their experience. So I just feel that we cannot just wait in the doctor's office for them to tell us about their stories. So that's why now we also spend a lot of time in the community in Newark to go to the elementary schools, also drug rehab centers, domestic violence shelters, to talk to the community people and help them find resources. So this is U.S. PSTF recommendations talking about screening for domestic violence. It's a B recommendation. Many organizations also recognize the healthcare settings as an ideal site for gun violence prevention and intervention among high-risk populations. So I think today we talk much about risk factors. I think young people, gang violence, that's one, right? And also people who have mental health issues and domestic violence. So I think that in the next step should be right here, I said urgent need for clinical safety protocols. We know that screening rates are high when the screening is mandated by the institution. It is low when it's not mandatory. So we can include prompts for domestic violence screening and gun safety assessment in the electronic medical record. Once domestic violence has been identified, then screen guns in the home. Healthcare professionals need additional training to talk about gun safety with people who have experienced or are at risk for domestic violence. Thank you.
Thank you. So you mentioned that part of this, I think, was sort of your formative research. Are there now widely accessible screening tools that can be easily utilized and validated tools that can be utilized in these kinds of settings?
Mm-hmm. So for domestic violence, we use HITS. I think these questions are easy to remember. H stands for physically hurt. I stands for insult. T stands for threaten. S stands for screamed. But I think that right now, although in the standardized protocol, after a patient screens positive, we are supposed to review the safety planning with the patient. So number one is immediate danger. In New Jersey, the law requires that there are two situations that we need to do mandatory reporting. One is that if the patient is injured and if the injury is caused by a weapon, or if child abuse is involved. In these two cases, we need to report. So I think that that's actually give us an opportunity to ask the patient about safety, about whether there is a gun in the home, and then we can add this additional question to the screening tool.
Great, thank you. We have one more round of applause for the whole panel. That was fantastic. Thank you. So I would now like to invite our Director of Outreach, Michael Guzmano, back up here, who will be leading us through a Q&A.
Hang on to those for a moment, and I'll be right with you. So thanks very much. So we have collected quite a number of incredible questions, which in many ways reinforce why we need to do more research so we can actually answer these questions better than we would like. I'm going to begin with just a few, and I will say one of the things I wanted to mention in terms of next steps, we've created a website. It has some information on it now. It's going to be populated with a lot more information over the coming weeks and months. And one of the things that we're going to be able to do is post stuff from this gathering, including sort of more thoughtful answers to some of your questions, where we're going to get together as a group and kind of fully flesh out some of these answers. So a couple of questions. One thing is we had a great question, which I assume had come from like one of our bosses or something, but it was about so after the initial funding runs out, how are you going to keep the thing going? And so first we're hoping that we'll continue to get annual support from the state. Obviously that will be a source of negotiation, but we are getting the money from the state with the idea that as researchers we're going to leverage this to bring in additional funding from foundations and from other sources, from working with all of you and helping you raise money as well. Which brings me to my next set of questions. And actually, Paul, if you want to give the mic to Elizabeth, I'm going to have her chime in with me. We had another set of questions from quite a number of groups. First of all, letting us know that you exist, and I'm thankful for that. And I'm glad that you're here, and also asking how we're going to work with you. How are we going to make the idea of community-based participatory research real, since you hear that phrase all the time, and sometimes it's real and sometimes it isn't. I will say a couple things very briefly, and then I'd like to invite Elizabeth Sloan-Power to sort of chime in with some of this. Every single one of us on this team is actually committed to conducting research in that way. Bernadette Hull earlier talked about community scientists. She meant that quite sincerely. So in addition to our formal advisory boards, part of my agenda for this summer, we just got started, we just got the money in November, we've just gotten started at the end of last year, is to spend a good portion of this summer going around the state and actually meeting with a lot of you. And so if you have groups and you want to work with us, or if you think our research can help support the things that you're doing, we want to hear from you, we want to know about your needs, and we want to talk about how we can partner you in productive ways. And so I'm going to be going around and doing that, and Elizabeth is going to be as well. So Elizabeth, do you want to say a word or two?
Hello everyone, welcome. I can't help it when I've turned around and I look at everybody here how inspired I am, because we cannot do this without you. They say that the root word of community is literally to commune, right? Or the desire to want to break bread or have a meal together, or at least be together and work together. And I say that because your role is as pivotal as our role. And so how do we go about doing that is exactly what we're doing today, right? We're having a meal, we just finished lunch, and we're saying, all right, now let's get together and let's do some work. And I know many of you have been in this field for a very long time. Just because we're having the launch of the center today is an indication of the work that you have done. And I just gave myself chills about the work that you've been doing, so I really appreciate it. And I know a lot of the work that you've been doing has been under great hardship. You've lost sons, you've lost daughters, you've been involved with violence yourself and have been affected, so it's really personal. And I want you to know that we take this very personal, and we take this very seriously, and we take our connection with you very, very very, very seriously. So Michael and I want to be here to really know each and every one of you in this room. I tried to get around to each table if I could earlier, because I want you to know, at least from a relational theory perspective, it suggested that the only way that we can grow and develop is with each other. So I hope that is an open invitation to really reach out to us on any level, and we will respond. Certainly our website is a good start, but you can connect with either Michael or myself through our personal emails. And we are now a community together, so I appreciate this opportunity to be here.
Thank you, Elizabeth. So I think if you want to, actually, if we could share that with Stephanie. There's another group. I'm trying to lump together our questions. Again, we're going to respond more fully, but we wanted to kind of get it started. And there were a whole collection of questions about how we're using data, how we're going to link data, and whether or not we're familiar with other efforts at data linkage in New Jersey. So, Stephanie, please.
So, yes. So the idea of data linkage is actually something that's really, where a lot of research nationally and in the state is going right now. There's a lot of various philanthropic groups and organizations that are funding gun violence research nationally, and really a lot of where that funding is going is toward data linkages. We know that there are existing groups, particularly at the Institute of Health and the Center for Aging at Rutgers, that are doing some of these existing data linkages, and some of you mentioned that in your questions. And so, you know, the answer is yes, like these are the people that we're looking to help us to develop really the data sets that and the space for the data sets to exist. One of the problems, as many of you are aware, with health data is the idea of HIPAA compliance and making sure that the data that we are integrating is being done in a way that is protective of individual privacy. And so that's a huge challenge. And I think that, you know, when we talk about developing linked data sets, a lot of it has to do with how do we do this in the setting of individual privacy and in the setting of making sure that we are being mindful of that. But there's really interesting questions that can be answered from linked data that can't be answered in other ways. So, you know, for example, if you are, if there's a shooting in which, you know, 3 individuals are shot, in a particular incident, those individuals are disconnected from one another in the entire electronic health record. They're never linked to being involved in the same incident. Only the criminal justice data can link those individuals to the same incident. And there's a lot of interesting things that we can find out by understanding what the health consequences are of those 3 individuals who are linked, that we can't understand if we don't have those kinds of data linkages. And so that's some of the really exciting and compelling things that we are looking at doing. But I do want to sort of you know, make sure that everybody is aware that a lot of everyone's like, well, why don't you just, you know, like bring all these data dumps together and have the computers figure it out? And part of the reason that it is so challenging is because we have to do it in this very sort of mindful, thoughtful, and HIPAA compliant way. But what we're hoping to do with that is to be able to provide this really comprehensive data set that our researchers can access, and it becomes a resource then across the entire center for any researcher who wants to be a part of it. So building that infrastructure is a lot of what we've been doing. And then I had so that I think that answered a couple of the questions, is like the who and where is all the data going to be stored. and are we working with the Center for Aging? And then how do we get doctors and school administrators to talk about firearm safety and to patients and parents in rural New Jersey where they're afraid of backlash from patients and parents? I think that's a really interesting question, and a lot of what we're doing when we talk about training is building that space where doctors, community workers, faith leaders, all kinds of people across various communities can feel comfortable having this conversation. And I think that it's presenting that data that shows that patients really want to talk to their doctors about this problem. Actually, the patients feel more comfortable talking to their doctors. It's the doctors that don't feel comfortable talking about it. And so changing that, doing that in our training institutions is, I think, one of the things that we definitely want to work on.
Thank you. And if I could just add on to that, because Stephanie's day job is to be a surgeon. My day job is to be a political scientist. I waited till all the elected officials were out of the room before I actually admitted that openly. But one of the things Congressman Pallone mentioned was the fact that, when he was first running for office, a lot of medical associations were very much sort of aligned with the NRA, and we actually have a question about whether the NRA is losing power. And he talked about the change, and I actually just recently published a paper in which I documented the fact that it's not just the American Medical Association, but the American College of Physicians, the American Academy of Pediatrics has actually shifted their positions remarkably. They have all come out with policy statements strongly in favor of gun control, of addressing research needs, and addressing violence more generally. So that's a positive development. We had another question kind of related to my political science expertise about how are you going to counter the slogans of the NRA and pro-gun groups that if you take away the guns, then only the criminals will have the guns. And I would sort of give a two-part answer to that. And one is that I think narratives are important, right? And counter-narratives are important. Storytelling is important. We have several people that have met around the room who have produced or are producing documentaries. I think film and the arts can be powerful mechanisms for telling the story and communicating this with people. But our stories and our narratives ought to be actually informed by facts. Sort of to go back to Governor Murphy and his quoting of Daniel Patrick Moynihan, you're entitled to your own opinions, but not your own facts. And so part of what we're trying to do is to make sure that the narratives we tell are actually in alignment with the evidence that we're able to marshal and distribute. So I'm sorry I didn't get to all the questions. We tried to lump as many. Again, we're going to use the website as an opportunity to come back to some of the questions we didn't address directly. And I think what we're going to do now is just open it up to the floor. I particularly want to invite you to see if you have any questions for any of our extraordinary panelists or any of the center leaders. Elizabeth has a microphone, and she's volunteered, and Michelle has a microphone, so they've both volunteered to share those if folks would like to make some statements or ask some questions.
Hi, thank you. Hi, my name is Henry Gage. I'm with the Jersey City Anti-Violence Coalition Movement, and I just wanted to share with you an experience just walking in the room. First of all, it's good to see so many people here, but secondly, I'm struck by the question of diversity. Considering the data that was presented, and considering the dais, I really appreciate the information. It reminds me of the gap that exists between those who are doing the research and those who are affected. And at some level, is it possible, rather than looking at the molecules and asking them questions at that granular level, can we also consider a fast-forward track where you visit the community with a guide, of course, because if you don't, no one's really going to talk. No one's going to talk. It's that serious. It's that little trust. But with a guide, it's possible to get some new insights, which could result in faster solutions, and maybe measure some of those.
Well, first, thank you very much for sharing that. I will say that I agree with you completely, and part of my job for the center is to connect with groups like yours and talk to you about how we can do that, how we can work together, and how we can bring you and make you a part of this research, right? You're not research subjects, you're our research partners in the people going out and doing work within the community.
So first I want to thank you for bringing that to everyone's attention, because in fact it is on the top of all of our minds. Acknowledging the fact that while we try to do our work to the best of our ability, there's some things that just aren't for us to do. And so the approach that we're trying to take is to do what we know, and to do what we know well in partnership with the folks that have had this lived experience. And recognizing that, because this is, I've been doing this for a long time, as well as many of the people on the leadership team have been doing this work for a long time, and we immediately recognize that we are not the catalyst for change. We are just there to help facilitate and support in the ways that we can, given our expertise. And so when we do this work, that's why we've continued to say over and over, I think you've heard more than once or twice or 10 times, that it takes all of us to work together in partnership. And I think that you're clearly identifying an issue that is present in this room. And quite frankly, some of it is this idea that we can all put on our suits and we can stand here in a room because our lives give us the ability to do that right now. But the folks that really are on the ground and able to inform a lot of this work can't come here to talk about this and stand here and say thank you and acknowledge everyone. And we realize that. And so, we do come up and get fancy and stand here and talk about what we think we know. But most of at least my day-to-day is spent trying to be more on the ground and understanding what it is that is driving these issues. And we recognize that there is a significant disparity in deaths by firearms, and in particular in New Jersey. So we can give you national statistics, but we led with that to basically say we have to refocus our message for people to understand that that we have these issues, and it's a collective issue regardless of what you look like or where you live. It's a collective issue for all of us, but we have to direct the message to the right places. And quite frankly, the mass shootings are really, a driving force. But in New Jersey, that's not our primary. That's not our number one issue. So I appreciate that you acknowledge that in the room.
Thank you. Could we get a microphone to the woman over here?
Thank you. Carol Stiller from Brady, New Jersey. This may be obvious, but I just wanted to say it out loud that just because we hear that gun deaths are going down, I think we all know that gun violence is not going down. It's the dedicated trauma surgeons who are here today and all across the country who are saving the lives of these gun victims, and that's why we need to have more data on just how many victims there are that are not killed. Thank you.
Thank you. We couldn't agree more. In the back.
Good afternoon. I had two questions. One was a follow-up. I was one of the questions about the community participatory research. Specifically, what will there be compensation and credit in the publishing of research for community members? It's, I think, one thing to talk about including them, and another thing to actually compensate the human beings who are connected to the problem. And then my second question is around safety for folks who participate in research, like you were talking about DV victims and whether it's folks who are associated with gun violence. Just if you've given thought to how you protect people from becoming injured as a result of participating in research. Thank you.
Absolutely. Paul, do you want to?
I'll take a first crack at that.
Let our director of research take over the research.
Those are all related questions, and I think they're excellent questions. I mean, I think I can provide some general sorts of answers. I think that the specifics will probably vary from project to project as we move forward in the research enterprise. In terms of compensation, and some of this I can only speak to the work that I've done personally. Others may want to weigh in on this if you've had direct interaction with patients, subjects, etc. We always pay individuals that we interview or survey that are included in our research when it's for kinds of research purposes. If it's not in the context of service provision, if it's not in the context of services rendered, etc. If it's purely for a research purpose, we are typically compensating our participants. Publishing is not a question I've experienced before, including the participants of the research in the publishing enterprise. Does anyone have experience with that? That's not a question I've come to before.
I can speak to that.
Yeah.
So I want to back up, and I think people use the words community-based participatory research loosely, but the CBPR, in fact, is actually a very strict criterion, an approach that underlies the research process that would take a whole other center event that I'd be happy to sit down and talk with you about. But I say this because if we were to engage in CBPR projects, which I'm not suggesting that all of the projects that are ongoing in the center will be CBPR projects. You should understand that because they'll be varied and different, and some will be driven by the center and some will be driven by the individuals that are funded through the center. Some will be CBPR perhaps, and some will not be. What I prefer to suggest is that we're trying to create an environment of engagement where there's continuous feedback loops from the community and back to the community in response to the needs that they've generated and ideas that they've generated. So I'm more comfortable talking about community engagement and interaction. With regard to the participation in the writing and the manuscripts, so peer-reviewed literature is important for all of us. It's important to demonstrate a rigorous knowledge base and a peer review process. And in fact, the people that read it are the couple of us sitting up here in suits. And that's important to us. It's important to generate. But that's not important to the vast majority of people that are going to use the information. So to be able to translate the work that we're doing, we would not be able to do that without the partnership of people that are engaged in the process, right? That people, of the stakeholders, whomever the audience and the generators might be. If I were to publish in the peer-reviewed literature for community-based participatory research, I would not be allowed to publish without the participation of community members from the original start of the identifying the research question all the way through the end to the production of the manuscript and publication and dissemination. So, not that I would try, but in fact, the answer is pretty simple, that if we were to use a CBPR approach in any of our projects and try to publish, we would clearly make sure that they were integrated because that's just what the approach dictates anyway.
And then if maybe one of you could comment on just the protection of participants.
Yeah, I was going to say, with respect to the issue of protecting safety and security and to an extent confidentiality of anyone who is taking part in the research that we do, it's worth noting that all research activities at Rutgers University, every university, but we're at Rutgers now, is overseen by an institutional review board whose job it is to ensure that the procedures are respectful of the confidentiality and the safety and security of the participants. So depending on the nature of the research that's being done, if it's out in the community, if it's in a police station, if it's in a hospital, procedures per project would have to be in place to ensure that whoever is taking part in procedures has that safety guaranteed. Whether it's the safety of the physical surroundings, whether it's the safety of the data that are generated. We keep data safe by keeping them anonymous or keeping them confidential or keeping them in password protected, encrypted, fancy computer files. There's a lot of things that we have to do as researchers, procedures we have to have in place to ensure that we're guaranteeing those things. So it's always a concern.
Great, thank you. So we have just a couple minutes left before they're going to kick us out of the room. So another question right here.
Yes, you do.
I'm right here.
Good afternoon, everyone. I'm Audrey Redding Rains from the Department of Social Work at Rutgers, Newark. And my question to the panel is, we've talked a lot about intimate partner violence. We've talked a lot about, hold on, let me get one more. The criminal justice system. My question to you is, trying to get a better understanding of gun violence, gun safety with this concept of school to prison pipeline and how it impacts the younger, impressionable students or kids of color, and how are we going to address that in talking about gun violence and gun safety and bringing that into the school to try kind of turn around this gun violence and the impact so that we can deflect or divert black and brown young boys, mainly males, from going into the prison system?
Hi, Audrey and I work together. We teach together.
Yes.
I just wanted to introduce Samson Stiles. He's the executive producer of that a documentary, Killing Beef, we were telling about.
Excuse me. How you doing? First of all, I'm gonna give you a brief summary about myself. I've been shot 5 times. I grew up in the hood in Brownsville, in Pink Houses Projects in East New York. I did 7 years in prison. I did juvenile time. Came home after doing 7 years in 2004 and turned my life around and became an award-winning journalist. So I documented, thank you. I documented the documentary I did, Killing Beef, Gun Violence in the Black Community, is largely about me and the guy that shot me, one of the guys that shot me 5 times, and us joining together and speaking at juvenile detention centers after he came home from doing 20 years in prison. That's rare, because a lot of gun violence is due to retaliation from people coming home from prison, and it could have went a total different way with us. So this documentary was 10 years in the making. I took 10 years, researched, and used my own story of the education system, missing fathers, even though I grew up in a 2-parent household, just things I've seen in the community that I know, that a lot of statistical data might miss, personal stories, issues that we know, that we could talk to, that we could speak about. So I put this in the documentary, and this is going to be a teaching tool that we also use when we come in contact with people that are from our community, as to show them why certain things are happening, right, that they may not have known of, that I didn't know until I was doing a documentary. I was like, oh, wow, this is why I was doing this. This is why I acted like, you know? So it's a research from personal instances, and it includes lawyers, it includes DAs, it includes community police, it includes the school system, the missing fathers, you know, fathers that are there, like all the misconceptions and the conceptions and the general consensus and just everything that's given, you know, from a personal experience, and to show how this personal experience is a micro to the macro, right? So this will, and it also gives knowledge to people that haven't been in those communities, that's teaching in these schools, that's policing these areas. It's also giving them an outline and a history lesson, as it is to the people that's already from the community. So this is an important tool. I didn't know how important it was when I was making it, but now it's like everyone that sees it. I had judges say, can I show this to some of my people in the legal department because it may help us with discretion on sentencing people. I'm like, wow, like, you know, like I didn't know that it will have that type of power. And also, we have also an emergency physician that works on people in the EU and as well. And part of the CAVI program, Dr. Gore, Dr. Robert Gore, he's also a TED speaker. He's in the documentary. We have our mayor, Ras Baraka, in the documentary. And, you know, so we basically address all the issues that we would have that we say they don't understand. After, you know, watching the film and having the panel discussions on the film, and also there's a workshop that we developed around it, it will help, you know, bridge those gaps.
Thank you so
Thank
much.
you. I just wanted to have everybody know that we're really super honored to have Samson on our advisory committee of education and training, as well as Jeff and this lovely table from the school. I was going to say the school, the Department of Social Work. If you just want to raise your hands, I'm super proud of you. So we're going to be going up and down the state, utilizing Samson's beautiful documentary and other people's documentary and films and education. And so thank you very much.
Thank you. So I think we have time for one more question, and then we should wrap up. The lady in the blue blazer was waving furiously just a moment. See, we're already doing good.
Yeah. Yes, I know. We'll get you Samson's information, and I'd love to have you part of us. Samson's film is Killing Beef. And where is it showing right now? On Revolt TV. Right now it's showing presently on Revolt TV, right? Yes. Yeah. We're going to begin to do some individual screenings and then larger screenings up and down the state. So if you would like an individual screening, yeah, if perhaps, is that the Unitarian Church? Ah, fantastic. Another group, another advocacy group that has done amazing work in gun violence prevention. Yeah, thank you very much. I think we can come down near the, if it's okay with you, that's down in the Cherry Hill area and really showcase where we're coming down. Thank you.
Okay. Oh, we have one more over here. All right. We will. We will put information just of this sort on their website. Yes. And if you're on our email list, we will send out a blast email letting you know where this will be shown.
I just have a really quick question. My name is Joy Cox. I'm from the New Jersey Medical School. And so my question is, given everything that we've learned here today, I'm just wondering if there's a dedicated timeline or benchmarks that have been set as to like what projects will get attention. What do you plan on rolling out first? Is there a priority list? That sort of thing.
Sure.
The priority list is in development. I mentioned at the last point on the slide that I showed for the research corps, we currently have an internal funding program that we have rolled out. We're accepting proposals currently. That information was released in January. We've been taking proposals in. So we are actively in the process of reviewing proposals that we've received for their scientific merit and quality and impact and all those kinds of things. Once we've had the chance to take a look through all of those, we will start making some funding priorities. We do have other priorities that we're developing as a leadership group as well. That's in process, but we're looking to do as much as we possibly can, as quickly as we possibly can, with as highest impact as we possibly can. So
right.
That's all I can really say.
And I was going to announce that please keep looking at our website. We will be making announcements. We're going to be making decisions over the coming weeks about these internal requests for proposals, and we'll be announcing which projects we're funding. One of the things that we've been working on, in addition to just getting the basic infrastructure of the center together, is working on these data projects. So one immediate priority, certainly that isn't related to one specific project, but is going to feed into lots of projects, is the work that Stephanie Bonney is doing, along with Mike Osterman and really the entire team, to try to link the data sets that are already available so we can start answering some of the questions that we don't currently have answers to. In addition, I just want to make one other announcement, sort of for planning in the future. We are going to be holding a 2-day research conference at some point in the fall, so we will also have announcements about that. And as I mentioned earlier, a large part of my summer is going to be spent going around the state. I've already made some arrangements to meet with people from departments of health around the state to talk about their interests and their needs and partnership opportunities. I have met with the United Unitarians and hope to do so more. And I've met with a number of groups here, and we've already started having conversations about getting together. So please get in touch with us. We want to do more of that. But mostly right now, I want to thank our panel. I want to thank Dr. Boxer. And I want to thank all of you for spending an entire day with us. So thanks so much. You'll be hearing more from us soon.